Adam, would you go ahead and call the roll?
Senators Huff,
Here.
Black, Bean, Brown, Searpoy, Crawford, Fitzwater, Henderson, Hudson, May, Neuenburn, Washington, Williams. You have a quorum, Senator.
All right, so the intention of the committee this morning would be to get through 10, 11, 12, and where's Dana? Right behind us. 13 and 17 also. I think those will go fairly quick. And then we will take a break because we've got about, the irony here is we don't legislate through the budget, but we've got about 85 pages of language that still needs to be polished up. So we're going to take a little break and work on that and then come back in as quick as we can. But we will start this morning with House Bill 10, first book, Taylor of the Department of Mental Health, whenever you're ready.
Book 1, Department of Mental Health, page 1, Office of the Director. No core
No changes
changes.
to core, House closed.
Page 3,
Overtime.
overtime, no core changes.
Yep, House and close on that.
Middle of page 3,
House
overtime
continue.
rule.
House and close.
Page 4, contracted staffing, House and Governor the same.
House and close.
Middle of page 4, DMH contracted staffing.
House and close.
Page 5, operational support.
House and close on the core.
Middle of page 5, a new decision item.
Go with the House. Same as Gov, same as Department, and close.
Page 7, staff training, no core changes.
Yep, House close on the core.
Page 8, employee support resources, House and Governor the same.
and
Middle of page
close.
8, employee support resources, new decision item.
Everybody's the same. House and close.
Page 10, refunds and debt offset escrow
Go with the House
transfer,
on the core.
no core changes. And 11 is the debt offset escrow, no core
Yep,
changes.
House close there.
Page 12, abandoned
fund.
fund transfer, no core
House
changes.
close.
Bottom of page 12, abandoned account transfer, cost to continue.
House and close on that.
Page 13, mental health trust fund, no core changes.
House and close on 13. DMH federal fund on 14. No core changes. House and close on the core.
Page 15, intergovernmental transfer for Medicaid payments, no
House and
core
close.
changes.
Yep.
Page 16, GR transfer for state match, no core changes.
House and close on that.
New decision item on page
Cost to
16.
continue. Go with the House and close there.
Page 17, IGT Medicaid transfer, no core changes.
House and close on the core.
Middle of page 17, IGT transfer, cost to continue.
House and closed.
Bottom of page 17, chip transfer.
Go with the House, Taylor, and close that.
Page 18, DSH transfer, no core changes.
House and closed.
Page 19,
GR transfer on
new
the chip.
decision
Yep.
item.
Go with the House on that, 20 million. And close.
Page 20, SWOPE health improvements, no longer needed.
Right. House closed.
Page 21, North Kansas City Hospital renovations, no longer needed.
Right. Go with the House on that. And I've got a new section 10094, the crisis counseling program at 2,157,945 and an FTE. All
That's-
federal.
Federal, yes.
Yep. All right. And close on 21. 22.
Page 22, C-Star provider renovations, no longer needed.
Yep, go with the House on the core, and then I've got two NDIs here, the Assisted Recovery Centers of America at $750,000, opioid funds on that. And new section 10096, BJC Webster Groves Children's Mental Health Hospital at $10 million on that one. Let's do GR on that, Taylor, on 22, and close.
Page 23, mental health hospital, no longer needed.
Yep, House and close there.
Okay.
That's book one.
Book 2, Department of Mental
Yep,
Health.
right when you are.
Page 24, SUD administration.
House and close on the core. You got pay plan, mileage.
Page 26, mental health administration, House and Governor the same.
Yep, House and close on that.
Page 28, SUD prevention and education.
House and close on the core. And we're on 29.
Yep.
I got a couple of NDIs here after the pay plan for the compulsive gambling prevention fund at 1.5 million and the federal grant authority underneath that of $1,966,876. Taylor, federal funds on that one. And close on 29.
Page 30, opioid community grants, no core
Yep,
changes.
House close on that.
Middle of
Cost
page
continue,
30.
go with the House.
Page 31, mental health suicide prevention, no core changes.
Go with the House on that. And I've got another NDI here for a K-12 telehealth program at $1.5 million GR. And close on 31.
Page 32, Heartland Center, no longer needed.
Yep, House close.
Page 33, Heartland Center, Kansas City, new decision item.
Yep, go with the House on the core on that, and then we've got a Heartland Center Springfield expansion at $1,800,000. And close on that.
Page 34, Arch Community Crisis Response, new decision item.
Yep, go with the House on that million and close.
Page 35, Prevention Resource Centers.
House close.
Page 36, Prevention Resource Network.
Go back to the governor on that, Taylor, and close on that. 37,
Page 37, Opioid Settlement Coordinator.
House close on that.
Page 38, Recovery Community Centers.
Let's go back to the governor and close. 39.
Page 39, Housing and Support Services, no longer needed.
House close.
Page
EMS
40.
PTSD pilot program, House close on that. 41.
Page 41,
Burrell.
Burrell Behavioral Health,
Yep,
no
go
longer
with
needed.
The House and close.
Page 42, Jewish Federation, no longer needed.
House and close.
Page 43, MOPAT for Moms, no longer needed.
Yep, House close there.
Page 44, Recovery Support Services.
Let's do a Senate position of $7,538,406.
Middle of
on
page,
that core.
middle of page 44, Opioid Community Grants, cost to continue.
Yep, go with the House on that.
Page 45, Recovery Support Services with Access to Recovery.
House and close on that.
Page 46, Addiction Medicine Fellowships.
House and close on that.
Page 47, the Embassy.
Go back to the governor on 47 and close on that. 48.
Page 48, Research Grants for Opioid, no
House
longer
and
needed.
close. Yep.
Page 49, Substance Use Disorder Community
Yeah, we got a
Treatment.
Senate position on this core, adding $500,000 GR. We're going to restore the housing liaisons that the House cut. So put 500 grand back in there.
Middle of page 49, Medication Cost Increase. This is
Yep.
located throughout multiple sections. You want to take a global stance
Yeah,
on this
go
one?
with the governor on that.
Okay. Bottom of page 49, St. Louis Opioid Overdose Reduction,
Go with
new
the House.
decision item.
Go with the House, Taylor, and close on that.
Middle of page 50,
50.
Utilization Cost Increase.
Yep.
House and over the same.
Everybody's the same. House and close.
Bottom of
FMAP
page,
adjustment, House
do you
and
want to
close.
take a global throughout this
Yeah.
book? Okay.
Yep.
Page 52, Gambling Addiction Support, new decision item.
We've got to take the House on the core, and then let's do the, let's see, let's do a healthcare line there, 250 grand on opioid funds on 52.
Yep.
Okay.
Page 53, Community Treatment Naloxone.
Yep. House on that 5 million and close.
Middle of page 53, Naloxone Saturation.
Yep. House close there.
And bottom of page 53 is the same, just as a one-time.
House and close.
Page 54, Mental Health Adult Community Treatment.
Let's go back to governor on the core, please.
Middle of page 54, 988, Services Cost to Continue.
House and close.
Middle of page
EMS
54.
PTSD GR pickup. House and close.
Bottom of page 54. This
Medication
is
cost to
another
increase.
global one.
Mr. Vice Chairman.
Middle of
Go-
page
governor.
50.
Governor and close
Yep.
on that. Yep.
Middle of page 55, Utilization Cost Increase.
Yeah. House and close.
Middle of page
Housing
55.
liaisons, go back to the governor.
Bottom of page 55 is the FMAP, which we decided with the House. Page
Correct.
56.
Yep, 56. After the pay plan, I've got a handful of new decision items here. We've got the behavioral health workforce at $159,000 GR. We've got the healthcare home rate adjustment, $310,967. If you want me to break it out, I can.
It's up to you.
109,902 GR, 201,065 federal. The compulsive gambling fund, I think everybody's familiar with. The prevention fund, 500,000. Crisis and open access utilization increase at 835,000. PTSD on the EMS program at $1 million, or EMS program, sorry, at $1 million GR. We've got a eating disorder council increase at 357,318. And the Compass Health at 3 million at the bottom of that page also. So that should close up 56.
Page 57, mental health youth community treatment.
Go with the house on the core, and then I've got an NDI here for the Youth Resiliency Campus in Greene County, $1.85 million, 850,000 GR, million Fed.
Yep.
And close that. 58.
Page 58, FQHC mental health services, no core changes.
Let's go with the Senate position, cut that in half at 300,000, and then I've got an NDI here for behavioral health services for children specifically, $400,000 GR. And close that.
Page 59, health transportation reimbursement, housing over the same.
Yep, go with the house on the core and close, 60.
Page 60, ETMS PTSD program.
Go with the house on the core, and then we've got a GR pickup, Senate position. We're taking that up $4 million, so it'll be $6,117,298.
Bottom of page
Close
60,
on that.
ETMS increase.
Yep, go with the house. And close on that.
Page 61, 988 cooperative grant.
We
No
can
longer
do the
needed.
house, yep, we can do the house on the core, and then I've got a doorways NDI at $750,000 GR.
Page
62.
62, Mo Connect system crisis module.
Yep, go with the house on that, close.
Page 63, Mo Connect system referral module.
House and close.
Page 64, civil commitment legal fees, no core changes.
Go with the house on the core.
Middle of page 64.
House continue, house, close, 65.
Page 65, forensic mobile teams.
Let's go with the house on the core.
Middle page 65, forensic mobile teams expansion.
Go with the house, close, 66.
Page 66, Epic.
EBICC, yep. Go with the house on that 500,000, close.
Page 67, medical care costs, no longer needed.
Yep, house, close on that. Recovery High School's on 68, go with the house, close on that, 69.
Page 69, recovery
Recovery
lighthouse, no longer needed.
Yeah, so we'll go with the house on, hey Brown, go with the house on the core, and then I've got an NDI for $980,000 for Recovery Lighthouse, opioid funds. You want to redo it? Where'd Adam go? We could redo attendance and now count you here, Senator. Anyway, ready for you.
Page 70, patients post-discharge, housing over the same.
Yep, go with the house on the core.
Middle of page 70, a new decision item.
Yeah, go with the house on the hospital reimbursement at $1 million. Then I've got a new NDI in a new section, 10129, adolescent mental health beds, $1,647,000 GR. Welcome back, Adam.
Page
71.
71, CCBHO substance use disorder, housing over the same.
Go with the house on that.
Middle of page 71,
The
CCBHO
index, go with the house
MEI.
on the index.
Bottom
Utilization
of page
cost increase, bottom of
71.
71, go with the house on that.
Bottom of page 71, top of page, that's an F map.
Yep.
With the global house.
Yep. And then I've got an NDI here with the compulsive gambling prevention fund at $3,825,466, broken out $1,825,466 federal, $2 million other funds. Guessing it's their own money,
But,
right? It's that same fund, right?
I believe it's,
I think it is.
yeah.
73.
73,
CCBHO,
mental health adults.
Yep. Go with the house on the core.
Middle page 73, behavioral health crisis centers.
Continue. Go with the house.
Bottom of
Economic
page
index, go with the
73,
house.
MEI.
Utilization increase. Go with the house on 73.
Middle of page 74, place of service.
Go back with the governor on that.
Middle of page 74, community-based placements.
Same. Go back with the governor there.
Bottom of page 74, community behavioral health liaisons.
House. And close on that.
Top of page 75, behavioral health crisis
Continue
centers.
CCBHOs. Go with the house on that. And then I've got 3 NDIs here for rural behavioral health services and independence at $3.5 million. The behavioral health crisis centers at $15,657,373. Only $3 million of which is GR. The rest is all Fed. And then crisis and open access utilization increase at $3,340,000 GR. Good.
Yep.
All right.
Page
76.
76, CCBHO mental health youth. Housing over the same.
Go with the house. Close.
Middle of page 76, CCBHO MEI.
House and close.
Bottom of page
Utilization cost
76.
increase. House and close on that.
Bottom of page, F map, house.
Then I got a couple of NDIs here. Taylor on 77. We got a CCBHO Youth Community Program non-Medicaid increase of $3 million. Use GR on that. Crisis and open access utilization increase $7,175,000, of which $4 million of that is federal. The rest is GR. Community behavioral health liaisons, we've talked about that a couple of times, $1 million on that. I think it's all federal. And behavioral health workforce, $789,484. All federal. All right, thanks. All right, should
Page-
close 77, 78.
Page 78, maternal health access program, no core changes.
Go with the House. Close.
Page 79, 988
988.
crisis.
Yep, House close on that.
Page 80, 988 crisis response
House
admin.
close on that.
Page 81,
F3HC substance abuse,
FQHC.
House close on $1 million.
Page 82, facility support.
Go with House, everybody's the same, close, 83.
Page 83, Fulton State Hospital.
Go with the House on the core.
Medication increase was a
Go
global
back
for
with
the
the governor.
gov.
The House cut that essentially in half, right?
Yes.
Yeah, go
In
back to the governor on that.
Environmental goods and services, the House can go over the same. We can
Everybody's the
take
same.
a.
Go back to the House.
Okay.
Yep. And 85.
Page 85.
Overtime.
Fulton State Hospital, no longer needed.
Right. House close on that.
Page 86, Fulton State Hospital sorts, no core changes.
House close on that.
And then environmental goods and services, which was a
Yep.
global.
Yeah,
House.
everybody's, yep. House close on that.
Page 87, Northwest Missouri Psychiatric Rehabilitation Center, housing over the same.
House close on that.
Middle page 87, medication cost increase, that was a global
Yep,
gov.
one with the gov.
And same with environmental services,
Yep,
that was
back
a
to
house
House.
global.
Bottom of 87, I've got a Senate position at 334,654, right?
Yes.
All right, perfect. That'll close 87, 80.
Page 89, Northwest Missouri Psychiatric Rehab overtime, housing over the same.
Go with the House.
Middle page 89, pay plan.
Back with the governor.
Page 90, Forensic Treatment Center, no core changes.
House, and close on that. Medicaid cost, that's governor.
Couple globals.
Yep.
Uh,
House underneath that. Again, global
Page,
positions.
page 92,
Yep.
Southeast Missouri Mental Health Center.
House and close there.
Middle page
Cost
92,
increase.
cost
Back
increase.
with the governor. You got the House position underneath that. Forensic mobile team expansion. House, they've got it in a new section, don't they?
Yes,
Okay.
yeah.
On 92. Yep, all right, thank you.
Okay. Page 95, Southeast Missouri Mental Health Center overtime. This section's no longer needed.
Yep, House close on that.
Page 96, Southeast Missouri Mental Health Center sorts.
Sorts, House close on the core.
Middle of page
Jail contract, go with
96.
the House. Environmental services, go with the House, it's all the same.
Page 98, Southeast Missouri Mental Health Center sorts overtime, no
Overtime.
longer needed.
House close on that.
Page 99, Center for Behavioral Medicine.
House on the core. Cost to continue, back with the governor. Again, global positions there, the House underneath that. Forensic mobile team
Bottom.
expansion, go with the House.
Top of page 100, the pay plan.
Yep, so Senate position, 364,947 on page 100 on that pay plan. Thank you, Taylor.
Page 101, Center for Behavioral Medicine overtime.
House on that.
Middle of page 101, pay plan.
Again, going back to the governor, I think, moving that, right?
Yes, moving it into the core.
Yep.
Page 102, Hawthorne Children's Psychiatric Hospital.
Go with the House on the core, governor on the increase in the middle of the page, back with the House on environmental goods and services, and then we got a
Bottom
Senate
of page
position.
102, pay plan.
Yep, Senate position on the pay plan at 189,882.
Page
104.
104, Hawthorne's Children's Psychiatric Hospital overtime.
Yep, House there,
Middle of
pay
page
plan,
104,
back to
pay
the
plan.
governor.
That's the end of book 2.
That finishes book 2. All right, we'll get started on book 3 on mental health.
Book 3 of Department of Mental Health. Page 105, DD Admin.
Go with the House, close on that.
Middle page
Take it up to
105,
Stabilization, go with
DD.
the House on that.
Page 107,
7.
DD Admin Medicaid.
House and close. Provider assessment on 108, go with the House, everybody's the same.
Page 109, HAP Center payments, no core changes.
Yep, House and close there.
Page 110, state waiver
State
programs no
go with
longer
the House,
needed.
close.
Page
Community
111, DD Community
Yeah, let's
programs.
do a Senate position here, 1.35 million reduction on that. We get some new info on that. So that'd make that, that'd make that number 2,366,955,594.
Yes.
Isn't that better?
We'll put that on.
Isn't that
Facebook.
better? Yeah, we just cut $1 million out of almost $2.4 billion line. Somebody will pound their chest. Go ahead, Taylor.
Middle of page 111, Mental Health Interagency Fund Authority cost to
Cost to
continue.
continue, go with House on that.
Bottom of page 111, DD Increased CHIP Authority cost to continue.
House there.
Bottom of page 111, top of page 112, DD
Everybody's the
Federal
same, go with
Authority.
the House. Autism Center GR pickup, go with the House and close.
Bottom of, or middle of page
Middle of page.
112, utilization cost.
Let's go back with the governor,
increase.
Taylor, on that.
Bottom of page
214 million.
112, top of page 113, Mo CDD slots and coordination.
Can we make a Senate position here at 15? Let's see, Senate position, let's add 1,582,608, of which 563,000 and change is GR. Rest
Okay.
expense.
Yep.
And close.
Middle of page 113, FMAP, that was a global
House,
house.
yep. House closed, you got pay
Page
plan mileage.
114,
Got a couple of NDIs on 114, DD targeted case management increase at 6.4 million. A DD Dayhab rate increase, it's roughly 3.2%. Our good senator from Kansas City area just stepped out, I guess. So that increase would be 9,602,295. And then the DD COLA at 1.7%, so it'd be 45,482,113. Lion's share of which is federal.
page,
And close on that, 115.
page 115, Autism Outreach Initiatives, no
yep.
core changes.
Go with the House on that.
Page 116, Autism Regional Projects, no core changes.
House, close on that.
Middle page 116, a new decision item.
Go with the House on that Regional Autism Center.
Page 117, ATIDD Training Pilot, no
Yep.
core changes.
House, close on that.
Page 118, Rolla Autism Center, no longer
Yep,
needed.
No longer needed, House will close.
Page 119, Autism Research, no
House
longer
close.
needed.
Yep, House close
Page
on that.
120, Springfield Autism Center,
Again,
no
not
longer
needed, House
needed.
close.
Page 121, Joplin Autism
same deal,
Center.
House and close.
Page 122, Springfield Autism
Go back to
Center.
the governor on that and close that.
Page 123, St. Louis County Autism Center, no longer needed.
Yep, House and close on that.
Page 124, HCBS Enhancements, no longer needed.
House and close, 125.
Page 125, DD Health
Health
Home,
Homes.
no core
Everybody's
changes.
the same, go with House, close.
Page 126, DD Patients Post-Discharge, no core changes.
House and close on the core. We
Middle
got
page
DD hospital
126.
reimbursement, go with the House.
Bottom of page 126, another increase
Yep.
of $1 million.
Yep, House and close on that.
Page 127, Community Support Staff, no core changes.
House and close there.
Page 128,
Development
DDA,
Disability
no core
grants.
changes.
Yep, House closed.
Page
129.
129, ICF
assessment
IID to
transfer.
GR.
House and close on that.
Page 130, GR to ICF IID transfer.
House and close there.
Page 131 through 140 are DD's regional offices and have no core
They
changes.
have no core changes, so we can kind of just, how many pages is that?
We will start back up on 141.
All right, so from 131 to 141, we're taking a House position because they're all the same, all the cores are the same. So skip ahead to 141.
Page 141, Bellefontaine Hab Center.
Go back to the governor on that one.
Another global for environmental goods
Yep.
and services.
House and close on that.
Page
FMAP adjustment,
141.
back to gov. And then the bottom of the pay
Pay
plan,
plan.
we got a Senate position of 371,661. And close on 141. 143.
Page 143, Bellefontaine Hab Center overtime.
Back to the governor on that one.
Middle page 143, pay
governor.
plan.
It's moving, isn't it?
Yes.
Yeah. It's not movers, because that doesn't work. This is actually just moving to a different section. Go ahead.
Page 144, Higginsville Hab Center.
Yep, governor on that one.
Middle page 144, environmental goods, that was a
House.
global.
F
Bottom
map
of
adjustment,
page.
go with gov. Then we got a Senate position on the pay plan at $253,861. And close on that. 146.
Page 146, Higginsville Hab Center overtime.
Go with governor and close.
Middle of page 146,
Same there
pay
on the pay
plan.
plan, governor.
Page 147,
Northwest
Northwest Community.
Yep, gov and close on that. Environmental services, you got the house.
Page 1.
Stabilization DD, the middle of the page 147, go with the house.
Bottom of
F
page
map
147,
adjustment, gov.
FMAP.
And
Page
I'm on
1.
150.
Page 150, Southwest Community Services.
Go back to the governor on the core.
Page 1.
House on the services, goods and services.
Middle of page 150, FMAP.
Yep, governor, and then we got a Senate position on the pay plan at $220,959. And close on that.
Page 152, Southwest Community Services overtime.
Go with the governor. Pay
Middle of
plan,
page
gov.
152. Page 153, St. Louis Developmental
Yep, go with the
Disabilities.
house, close on that. Services and goods, house, close on that.
Page 155, Southeast Missouri Residential Services.
Go with the governor on the core. House on goods and services in the middle. I'm on 157.
Page 157, Southeast Missouri Residential Services overtime.
Go with the governor. And close on that. 158.
Page 158,
Tubular sclerosis complex.
No
Go
core
with the house.
changes.
Yep, everybody's the same.
page
Half a
159,
million.
legal expense transfer.
Oh, the old legal expense dollar. And house close on that. Thanks, Taylor. Morning, Dan. Oh, you're fine. I was like, I'll leave it. Yeah, right. The reason consistency.
Oh, good, good. Did you take this off now?
Alex, you doing okay?
Perfect, so I'll just have to edit it.
Tom?
This mess, the E is fine, yes. Okay. And he said this? I guess he said this? Yeah. I didn't catch it. Gosh, okay. Oh, is this in this one? Oh, crap.
But that's a double stack. You know, you get two cups, because if you get a single cup, crunchy, sheer force of your anger. I can see that. Yeah. Rough. Can you not tell? You ready?
Yep.
Adam, are you ready? We're on 10. We're going to start Health and Senior Services. Book 1.
Book 1, Department of Health and Senior Services.
Like, we're just gonna- this is-
Is it okay. Page 1, Office of the Director,
Yep.
Operations and Support, no core
House-
changes.
House core, on the core.
Page
3.
3, Operations and Support, Division of Admin, no core, or Housing over the
Yep,
same.
house close on that.
Middle page 3, PPEC program, Housing over the
Everybody's
same.
the same, house close on that.
Page, bottom of page 3, unregulated
Yep, house close on that. Middle of page 4,
Middle page 4,
Staffing
DMI
increase.
staffing increase.
go with the house, they're the same.
Middle page 4, nutrition specialist staffing.
Same deal, everybody's the same, go with the house, close.
Bottom of page 5,
I got a couple of NDIs here after the pay plan. The Medicare enrollment team, 3 FTE and 290,313, all GR. And then other funds authority, a little over $1 million, $1,054,872 for the 16 FTE. That's a department request. I think they're going to doing great work there. All right, page 6.
page
Close that.
6, health initiatives fund transfer, no core
Go
changes.
with the house, close.
Page 7, debt offset escrow, no core changes.
House and close.
Page 8, refunds, no core changes.
House and close on that.
Page 9, federal grants and donated funds, no core changes.
House and close on 9.
And page
Top
10,
10, yep.
donated funds, no core
Yep.
changes.
House close on that.
Page 11, medical preceptorship transfer, no core
Transfer.
changes.
House and close.
Page 12, DCPH program operations, no longer needed.
House and close.
Page 13, no core changes. Cancer and
House.
chronic disease.
Yep, house and close on that. You got a
Middle
cross
of-
continue in the middle of the page. Everybody's the same. House and close on 102,673.
Page
I'm on
15, environmental public health, no longer needed.
House and close on that.
Page 16, communicable disease control and prevention, House and govern the same.
House on the core.
CHIP program, cost to
Cost to continue
continue.
on the CHIP program, House.
Bottom of page 16,
FMAP
FMAP.
adjustment. Yep, House and close.
Page
18.
18, community health and wellness
Go with
initiatives.
the House and close on that.
Middle page 18, SRAE grant increase, House and govern the
House
same.
and govern the same. Go with the House.
Bottom of page 18,
Cost to
PHH.
continue. House and close. On 20.
Page 20, substance use
grants.
disorder grant program, House and
House-
govern the
yep,
same. Middle
House
page
close on that.
20, additional staff resources.
Go with the House on the middle of page 20.
Page
We got
21,
two more.
naloxone distribution, no longer needed.
House close on that.
Page 22, tobacco addiction prevention, no core changes.
You can go with the House on the core, and then we got a Senate position underneath, adding $1 million to that, so it'd be 1.6 million on the bottom line, the addiction prevention. And close on that. 23.
Page 23, tobacco cessation, no core changes.
Again, go with the House on the core, then a Senate position underneath at 2.3 million. And close that. 24.
Page 24, DCPH admin, no core changes.
House close on that.
Middle of page 24, PHHS grant, cost to continue.
Go with the House, do the same as Gov.
Page 26, practical POCUS.
Yeah, go with the House on that.
Page 27, women's health initiatives, no
House.
longer needed.
House close on that. 28.
Page 28, emergency preparedness and response.
House on the core, and then I've got a Senate position on the ventilator maintenance. We're going to knock that down considerably and just leave it at $150,000, which I've been told by the department that'll keep about 100 of those ventilators maintained for the foreseeable future. We got a grant authority underneath that. Take the House position on that, same as Gov.
Bottom of page 28,
Yep.
environmental health capacity grant.
Yep. House and close on the bottom of 28. I got an NDI at the bottom of 29 for statewide EMS communication system increase at $75,000. It's all fed.
Page 30, maternal mortality, no longer needed.
Yep, House and close.
Page 31, breast cancer navigation, no longer needed.
House and close on that.
Page 32, environmental public health, House and govern the same.
Hang on a second. What do you want?
Page 32.
I've got the lead abatement loan program.
Oh,
What you're at?
yes.
All right, 32.
House and govern the
Yep,
same.
go with House on
Middle
that.
page 32, unregulated psychoactive.
Yep, House and close on that.
Bottom of page 32, PHA.
Grant costs continue, go with House on that. Top
Top of
33,
page 33, other funds authority.
House and close.
Middle of page 33,
Expansion,
circular
House.
expansion.
Yep, House and close on that.
Page 35, Springfield doula services, no longer needed.
Go with the House and close on that.
Page 36, prenatal care.
House and close there.
Page 37, women's health
closed.
services, no longer needed. Page 38, genetic and
Next.
newborn health services,
House
and
and
govern the
close there.
same.
You got the pay plan.
Page 40, newborn safety incubator.
Yep, active governor there.
Page 41, Elks Mobile Dental, no longer needed.
House and close on that.
Page 42, health informatics and epidemiology, no core changes.
House on the core.
Middle of page
Grant costs
42.
continue, go with the House.
Bottom of page 42, DMI staffing increase.
Same, go with the House. Then I've got an NDI, adding $300,000 at the bottom of 43. You got that note, Taylor?
Yes.
Okay. Perfect. 300. 3 grand.
Page 44, child and adult care food program, no longer needed.
Yep, House and close on that.
Page 45, summer
Summer food
foods,
service. Yep, House and
no
close
longer
on that.
needed. Page 46,
Ryan White program, House and close on that.
page 48, Kansas City Hunger Nonprofit,
Yep.
no longer needed.
House
Page
and close there.
49, Office of Women's Health and Office of Primary
Yep.
Care and Rural Health, no
House.
longer needed.
Close.
Page 50, local public health agency support, House and govern the same.
House and close on that. Grant costs continue, go with the House.
Middle, or bottom of page
LPHA
50.
core restoration. Yeah, let's do a Senate position here on the bottom of 50 of 1.15 million, and we're going to remove the House has that as a one-time designation. We're going to take that off. Make it ongoing. And close on 50.
Page 52, Primo program, no longer needed.
Yep, House closed.
Page 53, medical loan program, no longer needed.
House and closed.
Page 54, nurse loan program, no longer needed.
House and closed.
Page 55, nutrition services, House and govern the same.
House and closed.
Middle of page 55, nutrition
Staffing,
specialist
yep.
staffing.
House and go with the same. Go with House closed.
Page 57, rural physician grant program, no longer needed.
House and close on that.
Page 58, rural health and primary care initiatives.
House, close. Everybody
Middle of
sign.
page 58, nurse
Loan
loan
transfer.
funds
Yep.
transfer.
House, close on that.
Page 59.
I got a couple of NDIs at the bottom of 59 after the pay plan. We got a Mercy Springfield residency program at $3.25 million, all GR, and then we've got a, let's see, GME residency program increase at $487,500. Opioid funds on that one, right, Taylor? All right. And close on 59.
Page 60, doctor residency, no longer needed.
Go with the house, close.
Page 61, oral health services and initiatives, no core changes.
House and close there.
Middle of page 61, Elks dental increase.
Yep, $200,000. Go with the house on that.
Page 63 through the end of book 1 are no longer needed. They've either been reallocated or reduced.
Right.
So we can go with,
Go with the house to the end of the book.
yep.
And close. All right, I'm on book 2.
Department of Health and Senior Services, book 2, page 68, small rural hospital improvement program, no longer needed.
House and close. Nursing home strike team.
Page
House and
69, no longer needed. Page 70, health-associated infections, no longer
close. House and
needed.
close.
Page 71, travelers' health, no longer needed.
House and close on that.
Page 72, minority health initiatives.
Yep, house and close on that. Same as go. Same as department.
Page 74, disease intervention, no longer needed.
House and close on
Page
that.
75, immunization info systems, no longer needed.
House and close on that.
Page 76, congenital exposure,
Yep.
no longer needed.
House and close on that.
Page 77, health info systems capacity, no
Capacity.
longer needed.
House and close.
Page 78, ELC reopening schools, no
House
longer
and close
needed.
there.
Page 79, women's health and wellness,
Yep.
no core
House.
changes. Middle
House
of page
closed.
79, extended women's health, cost to continue.
$21 million. Women's health right there. House and close on that.
Bottom of page 79, Justice for Survivors Fund
Yep,
Authority.
100,000 on that. House and close on that. I've got an NDI here on the Springfield Doula Services increase of $775,000. GR on that. Taylor,
Page 81, doula registry.
go with the house on that. Close.
Page 82, communicable disease outbreak response, no longer needed.
Because we don't think that's ever going to happen again. Okay. House and close.
Page 83, fetal infant mortality review, no core changes.
House and close. Coroner's Training Fund. House and close. Yep. And
Page
then I got-
85.
Yeah, I got 85. I've got a couple of NDIs here. The Vital Records Replacement System at $1.763 million, and the Samuel Rogers at $700,000 GR on that one.
Page 86, COVID response and ARPA initiatives. House and Gov are the same.
Yep. House and close.
Middle
ARPA
page
Grant Authority.
86.
House and close. Pay plan.
Page 88, special health care needs, no longer needed.
House and close there.
Page 89, state public
Lab.
health lab.
House and close there.
Middle page
Both of those.
89, other funds authority.
House and close there.
Page 91, special health care needs non-medical, no longer needed.
Yep. House and close.
Page 92, special health care needs program, no longer
House
needed.
and close. Brain
Page
injury,
93, head
services.
injury.
House and close.
Page 94,
Special
children with
needs.
special.
House and close.
Page
AAA's give
95,
five.
AAA's give
Yep.
5.
House and close on that.
Page 96, home delivered meals.
Yep. House and close there.
Page 97, DSCS program operations. House and Gov are the same.
House and close on 97. You got the pay plan. And I got a couple of NDIs at the bottom of 98. Alzheimer's Dementia Services coordinators at $145,719, and that's 2 FTEs, all GR, and then the caregiver training and support at 60,001 FTE federal. Right?
Mhm.
Great. And close on those.
Page 99,
99.
Senior and Disability Services Non-Medicaid Programs,
Yeah,
House
we
and
can
cover the same.
Yep, take the House on the core, and then we've got the caregiver training support NDI at 949,000 underneath there, all GR. Yep, that was 99. We took the House on the core, and then we got an NDI of just $51,000 under $1 million.
Page
You know
100,
my sticky note? Consumer directed services, go with the House on the core.
middle of page 100, Medicaid HCBS cost to
House
continue.
go with the House. FMAP
Page
adjustment, go with
100.
the House.
Page 101, Medicaid HCBS.
Yep, go back to the governor on that one.
Middle of page
604.
101, Medicaid HCBS cost to continue.
House is fine. Then we got a Senate position on the home delivered meals at, well, it looks like $2,227,025, right? Which would get that up to like, it's like $7 a meal, $7.14
A little over, yep.
a meal, which is pretty incredible they can do that. Okay. Then we got the FMAP under there. Go with the House on that. I got one more NDI on 102, new section 10.916 for the complex care assistant at $11 million, of which $3.8 million is GR, the rest is Fed. 102.
Page,
And close that. 103.
page 103, HCBS enhancements no longer needed.
Yep. House will close on that.
Page 104, Senior Services Growth and Development Program transfer. House and cover the same.
House close there.
Middle page 104, a new decision item.
Yep. Go with the House on that. House and the Gov are the same.
Page 105, AAA's.
AAA's on the
House and cover the same.
contracts on the core. Go with the House.
Middle of page 105, Older Americans Act Authority.
You have anything to say about that, Mr. Vice Chairman?
We'll both be old someday.
Oh, you think?
I'm already there.
That was kind of my
I've
insinuation.
crossed
Go with the
line.
House. You got a $3 million increase there.
I've crossed it.
Page
Yep.
106.
Yep, I got a new NDI here for the Ombudsman program increase, $2,425,000 GR on 106, and close on that.
Page 107, AAA meal production.
Yep, House close there,
Page 108, Alzheimer's services, no core changes.
House close there,
Middle page 108,
Grants.
Alzheimer's respite grants.
House close.
Bottom of page 108, Alzheimer's training grants, increase.
Yep, House increased it by $250,000, go with the House on that, close on that.
Page 109, Senior Independent Living Programs, no core changes.
House close there,
Page 110, Paquin Towers.
yep, House close on that.
Page
Naturalization
111,
assistance, go with the House on that.
page 112, Program Operations for DRL.
Everybody's the same, go with the House on the core.
Middle of page 112, PPEC Program, House
Yep.
and cover the same.
House and close.
Bottom of page 112, top of page 113, Conru Services Enhancement.
House and close,
Middle of page
113.
113,
System
D&DD
replacement.
System
Yep.
Replacement.
Go with House on
Bottom
that.
of page 113, SHCSA Program Database. House and cover the
close.
same.
Yep, and then I've got an NDI at the bottom of 115 for EMS, for high need schools at $1.6 million. All Fed, right?
Yes.
Okay.
Page 116, Time Critical Diagnosis.
Yep.
Diagnosis.
House and close.
Page 117,
Nursing home.
Long-Term,
Yep, House and
no
close on
core
that.
changes.
Medical
Page
marijuana.
118, Medical Marijuana.
Everybody's
House and cover the
House
same.
close.
Page
Adult use
119,
cannabis.
Adult Use Cannabis. House and cover the same.
House and close.
Page 120,
SUD
Adult Use
grants.
Substance Use Disorder,
Yep.
no core changes.
House
Middle of
and
page
close
120,
grants. Yep,
Adult Use Substance Use Disorder Grants.
House and close on that.
Page 121, FQHC Substance Use
Go
Disorder
back to the
Grants.
Governor on that. On 121, 122.
Page 122, Youth Substance Use Grants, no core changes.
Go with the House on the core.
Middle of page 122, Adult Use Substance
Same
Use
as the
Disorder Grants.
Yep, let's go with the House on that. And then I've got an NDI for crisis and open access utilization, $3,225,000. And close on 122. 123.
Page 123, Youth Services
Go with the House
Liaisons,
on
no
that.
core
Everybody's the
changes.
same.
Middle of page
SUD grants.
123,
Yep, House close there.
page 124, Peer Respite Services Grant, no core changes.
House close on
Middle
core.
page 124,
House
additional
added
grants.
500,000. That's fine. Go with the House on that.
Page 125, Alcohol Abuse Prevention, no core
House
changes.
and close there.
Bottom of page
Grants.
125,
Yep, same deal. House and close on that.
page 126, FQHC.
treatment. Go with the Gov. Go back to the Governor on that one.
Page 127, Recovery Support Services and Recovery Community Centers.
House and close.
Page 128, Better Life in Recovery.
Go with the House, and then
Middle
we
of
got,
page.
go ahead. Senate position on the Better Life Recovery on the next line down. We'll do a Senate position at $675,000 and remove the one-time designation. Taylor, thank you.
Page 129, Supreme Court grants, no core changes.
No. House close on that.
Bottom of page 129,
Grants.
adult use
House
grants.
close on that.
Page 130, DESI grants.
Grants, yep.
No core
House
changes.
Close.
Page 131,
That's
Veterans
commission
Commission transfer, no core
Yep.
changes.
House close there.
Page 132, adult use cannabis transfer, no core changes.
House and close.
Middle of page 132, adult use revenue transfer.
Yep. House close.
Bottom of
Cannabis
page
transfer,
132.
House and close.
Page 133, legal
Legal
expense. No core
House and
changes.
Thank you, Taylor. Kind of on an island down there, Senator. Everybody get 'em. They're so talkative that I didn't even notice that they left. Yeah, good. Yes, Dan?
No, I,
Should be apologizing to these people. Maybe the other 6 of them that are downstairs trying to use this piece of equipment. And I'll just tell you what they're doing. I told them it was true. I said, write them in the cell, write them in Word, and those printed the way they were here, then we're gonna figure out how to make the cell work on that. But I'm not gonna have a waste of time down there. I mean, like, the thing was offline yesterday for how many hours? 10? Oh, no, they say that's not their fault. Do they? Oh, no, they're not their problem. Yeah, yeah, it's everybody. Yeah, we got some. Yep. Yep.
I was not,
You wanna be responsible for it now?
somebody's gotta take a beat, and it's probably me, so, yeah, I will.
The reason to beat a dead horse. I gotta ask about it on the radio. Apparently people listen to this. Yeah. Shocking to me.
Well, no, there is
Like,
a-
oh, you got like an IT problem. I was like, problem? Problem?
Where were you on the radio? Where were you on the radio at?
I don't know.
You're right
Probably some
here.
AM station or something. I don't know.
Yeah.
Some ham radio thing. Some dude's basement. Bill, how you doing this morning? Good? Yeah, you? Good? Bruce, Kara? Morning. Dude, what? Brutal? You think this is brutal? You ever been to a house here? This is nothing.
We sat together.
I spent
Oh,
eight,
my.
right,
4 in the morning.
right.
Oh my. Yeah. This is nothing.
Remember, I did 8 years in the
Yeah.
house and 7 on
I've
both.
still got 2 to go back. I can go back. Yes, you
can.
Heck yeah. I'm looking forward to that.
Right.
I'll get doors for you.
It's gonna be-
We just have to keep linking out.
It's gonna be like 85 years. I'll be rusty going back.
No, no, not happening.
You got any service left over there?
Yes.
Do you really?
No, I don't.
We gotta go back before you die.
I thought you did 8, you didn't do 8.
I probably couldn't get elected again.
I've got 1 year left. I don't know how.
Do you really? We can probably get you in. There's not very many rules in there.
Well, I did my 8, I'm 8 in house. I did my 8
You're
years
like
in
a lifer.
jail over there.
You're like a lifer. You got 8 over here too, right?
Yes. So I I need you to extend the term limit so I can.
I have no authority to do that. If we can do it in the budget, I can already have it done.
Wait till I leave and do it.
Right.
Group, can we help you? You good? I know. Have a question we need an answer? All good? Where it at? We've got House Bill 11 in front of us now. We got the Department of Social Services, Book 1 of 6.
Yep.
Cassidy,
Book
welcome
1,
to the
Office
show.
of the Director and Support Division. Page 1, Office of the Director.
Yep, go with the governor on that one.
Okay. Page 3, Children's Division Residential Program Unit. No core
House
changes.
closed there. We got staff
And
training.
then-
Go with House in the middle of 3. Middle of 5.
Page
Grants and
5, Federal.
donations. Go with House.
No core changes.
Yep.
House.
Closed.
Page 6, Child Care IT Consolidated Transfer. Appropriation
House.
Authority not needed.
House closed there.
Page 7, OAIT Federal Transfer. No core changes.
Go with the House on the core.
And then an NDI.
Yep, cost to continue on that. Go with the House. And then I've got an NDI for a new section 11022 for the Citizen Engagement Platform Medicaid Application $4 million GR. And close on 7. Welcome
Okay.
back, Rudy.
Page 8, Human Resource Center. No core changes.
Yep, House closed on the core.
Page 10, Stat. No core changes between the Governor and House.
House closed on the core.
And then an NDI
The
for the
pay
commissioned
adjustment.
officers.
Yep. Go with the House on that.
All right.
Almost $32,000. And close on 11.
Page 11.
Medicaid audit compliance. Go with the House on the core.
And then
Governor
a
on the
NDI.
enrollment system, please. House cut it out. We're putting it back in. And close.
Page 13, Systems Management. No core changes.
House closed on the core.
And an NDI for cost to continue.
Yep. House and close there.
Page 14, MAC
Interface.
Provider Enrollment System. No
Go
core
with the
changes.
House on the core. Then we got the enrollment system. Go with the governor. Go back to the governor. The House took a chunk out of that. Back to the governor on 14. 15.
Page 15, Recovery Audit Contract. No core changes.
Yep. House and close there.
Page 16, Division of Finance and Administrative Services.
House and close on the core. I'm on 18.
Page 18, Child Welfare Eligibility Unit. No core changes.
No core changes. Go with the House on that. 20.
Page 20, Compliance Services Unit. No core changes.
House and close on that. You got the pay plan.
Page 22, Contract Out Services for the Compliance Service Unit. No core changes.
22. Contracted out services. Go with the House on the 1.6 million. Yep. And close.
Page 23, Revenue Maximization.
Welcome back, Jason.
No core changes.
House and close on that million.
Page 24, Receipt and Disbursement Refunds.
Governor there. And close.
Page 25, County
County
Detention Payments.
Payments. House and close are the same. 26.
Page 26,
Legal
Division of
services.
Legal Services.
Go back to Gov on that one. House cut him a little bit. Back to Governor.
Page
And
28, DLS Permanency. No core changes.
House and close there. 30.
Page 30, Non-Recurring Legal Expenses. No core changes.
House and close there. On the core.
Page 31, Parents' Legal Expenses. No core changes.
House and close there.
Page 32, Title 4E Reimbursement. No core changes.
No core change. House and close.
Page 33, Kinship Care Legal Assistance.
Yeah, let's do
House
a s-
NDI.
Yeah, let's do a Senate position here. $200,000 general revenue, so we're adding $145,000 on that last page of Book 1 of 6. Thank you, Cassidy.
Book 2, Part 1 of Division of Family Support. Page 34, Admin for the Family Support. The House made
Page
a
34,
reduction.
top of the page. Go with the governor on that.
Okay.
36.
Page 36, IM Field Staff and Operations.
Go with the governor on the core, and then I've got a Senate position on the FSD staffing of $5,374,987 E&E, of which GR obligation would be $2,311,244, and the rest being federal.
And then there's an NDI at the bottom of page 36, top of page 37 for the customer portal cost to continue.
Yeah, go with the House on that. That's fine.
And then in the middle of page 37, an NDI for the provider portal.
Yep. House and close there. Bottom,
Bottom
of
of
37.
page 37, NDI for
Cost to
the,
continue. Go with the House on that.
okay, followed by the pay plan.
Yep. I'm on 40.
Page 40, the appropriation authority no longer needed.
Yep. House and close on that. Snap.
Page 41, appropriation authority no
Same
longer
deal.
needed.
House and close on that. Call
Page
center
42,
transfer.
TANF, IM call center, no
Everybody's
core
the same on
changes.
the core. House and close. Pay plans underneath there.
Page 43, child care, IM call center.
Yep. Go back to Gov on that one. And
Page
close
44, adult expansion group, IM call center, no core changes.
Go with the House on the core on that, Cassidy, and close.
Page
Item call center
45.
snap on 45, go back to the governor. I'm on 47.
Page 47, I am call center for CHIP. No core
Yep.
changes.
No core changes, go with the House on that. 49.
Page 49, I am call center IVR. No core changes.
Yep, House closed there. We got the
And
call
then
center,
NDI.
IVR, go with the House. We got,
Okay.
what, half a million
Page
out of that.
50, public acute care hospital. No core changes.
House and close there. 51.
Page 51, family support staff training.
Go with the House on that, everybody's the same.
Page 52, double up food bucks. No core changes.
Yeah, go with the House on the core, and then we've got a couple of NDIs, I think 2 million GR on this same double up food bucks program, and then a new section 11127, 11127, the resettlement at 37,904,538. It's all Fed funds, right, Cassidy? Okay,
Yes.
perfect. That should close 52.
Page 53, EBT. No
Well,
core changes.
that was 52. 53. Sorry.
Page 53, EBT. No core changes.
Yep. House close.
Page 54, appropriation no longer needed.
House and close there. Summer
Page
EBT program
55, summer
admin on the
EBT.
core. Go with the House on that. 55, 56.
No
Metis
longer
Magi,
needed.
Go with the House on that.
Page 57, Metis child care subsidy. No
Go
longer
with-
needed.
Yep. Go with the House on that. 58.
Page 58,
Summer
summer
EBT.
EBT program. No core changes.
Go with the House on the core.
And then followed by an
Cost to
NDI.
continue.
The House moved it to a different section.
Yep. So we can take the House on this.
Okay.
It's moved, so don't lose your minds yet.
Okay.
Okay.
Page 59,
59.
summer EBT Sunbucks benefits. This is where they moved that money
And
to.
then it showed up. Look at that. There, it's on the next page. Go with the House on that.
Page 60, no longer needed.
60?
Yes, no longer
Yep,
needed.
go with the House on that.
Page 61, Polk County Trust. No core changes.
10 grand, House and close on that.
Page 62, famous costs.
Go with the governor on that one. And close.
Page 63, no longer needed.
Columbia, House and close there.
Page 64,
Metis,
Metis
again.
Chip Magi. No core changes.
Go with the House on the core. we got
And then
federal
an
funds.
NDI for a Metis cost to continue.
Yep, House on that's fine. Welcome back, David.
Page 65,
Snap.
Metis Snap. No core changes.
House and close, and we got the cost
Fall.
to continue. Go with the House.
Page 66, Metis TANF. No core changes.
House and close there. 200 grand. Metis.
Page 67, Metis Independent Verification of
Yep.
Validation. No core changes.
House and close there. Metis,
Page 68, Metis ECM. No
Yep.
core changes.
House and close there. We got
Followed
cost to
by
continue in the
cost
middle of the
continue.
page. House close there.
Page 69, Metis PMO. No core changes.
House close there.
Page 70, Metis Adult Medicaid. No core changes.
House and close there. Then we got
And
the
an
adult
NDI.
Medicaid. Go back to the governor on that 30 million with House. Yep. On 70. That'll close 70, 71.
Page 71, Vernon County
Vernon
Youth
County,
Center. No core
longer
changes.
needed. House and close.
Page
Walls and beyond.
72,
House and close.
page 73,
Eligibility
LGB.
verification. House and close.
Page
Alphabet
74, Alphabet
Academy.
Academy
Yep. House
Facility.
and close.
Page 75, Food Nutrition Program. No
We
core
can take the House
changes.
on the core, and then I got a couple of NDIs here. 11166 Senior Citizen Activity Center, 100 grand. GR. Then we've got Bridges to Success, 11168. That's in Columbia, 500,000 GR. And then 11169, the Workforce Development Training Program at $2.5 million GR, and that should close 75. Senator Washington.
Well, it wouldn't be a good day without me asking a question. I just have a quick question, Mr. Chair. I didn't hear you on the activity on the Senior Activity Center. Did you say GR?
Yeah, I did. $100,000 GR.
Thank you.
You're welcome. Cassie, I'm ready when you are. 76.
Page 76, Save Our Sons and Sisters Program. No core changes between the governor and the House.
No core changes, so we can go with the House on that, and then I've got an NDI for $500,000 TANF underneath there,
Okay.
which would make that an even million, right?
Yes.
Fantastic. 77.
Page 77, Higher Aspirations. No core changes.
Same deal here. We can take the House on the core and then add $100,000 TANF on that same line on 77.
Page
78.
78, Total Man. No core changes.
Yep, go with the House on that, and then again, we're going to add $150,000 TANF money to make that total of $250,000 total. 78. And close. 79.
Page 79, fathers and families, no core
Yep.
changes.
House will close there.
Followed by an NDI that the House added
Yep,
of
they
one.
added another million. We'll go with house on that. That's fine. 80.
Page 80, Life Unlimited Housing Project, no core changes.
That's fine. Go with the house on that.
Page 81,
Kansas
Prosperity.
City. Go with the governor on this. And I've got an NDI, casting on 81 for new section 11172 for the Special Learning Center in Cole County at 4 million. GR.
Yes.
And close that. 82. 82.
Page 82, Future in Action,
Go back to governor on that. House cut it.
and NDI.
Same deal. Go back to governor.
Page
Mr.
83,
Chair, I'm
UCP
sorry.
Heartland.
Senator Washington.
On
Yes.
81, did we go with the House recommendation?
81. No, we went with the governor on 81.
Okay, I just wanted to be verbal that Prosperity is an amazing program and we were hoping to fund it.
Understood.
Thank
you,
you.
Senator. I'm on 83.
Page 83, UCP Heartland St. Louis, a House NDI.
Yep. Go with the governor and then new section 11179 for 100 black men in St. Louis, project rebound $660,000 GR. And close on that. 84.
Page 84, Integrated Student Support Services, no core changes.
Yeah. Go with the Senate position is 0 on the core, then go back to the governor on the bottom of 84. And close. 85.
Page 85, Rise Drew Lewis
Yeah,
Foundation,
go with the
no core
house
changes.
on the core, and then we've got an NDI, $250,000 to TANF. TANF funds there, so be a little less than $1 million.
Page 86, Hope Missions, no core changes.
House and close.
Page 87,
Morning
Morning
Star.
Star Life Center.
Yeah, we can go with the house on that, and then we've got an NDI here for $500,000, same line essentially. So add a Senate line under there, Cassidy, $500,000 GR.
Page 88,
Thank you. Yep.
no core changes. Riverview West.
House and close on that.
Dorset. Page 89, Better Family Life, no core
Yep. You can
changes.
take the house on the core and then add an NDI $1 million TANF on that one.
Page 90, I Am King
close.
Foundation, no core changes.
Yep. Again, we can do the house on the core and then add a $50,000 NDI underneath there, TANF funds.
I'm sorry.
No, Senator Washington.
Back on
Well, once
page,
you get going, right?
oh no, page
Yeah.
87.
87.
You go so fast, Chair, you're so efficient. On Morning Star Life
we put
Center.
$500,000 of general revenue in that.
Okay,
Yep.
you're going so fast.
I'm just trying to keep up with our analysts, who work surprisingly faster than a non-working computer system downstairs.
Page 91, Annie Malone.
Page 90, I'm sorry. Did we do 50K TANF?
We did, Senator. We did.
I'm paying attention, I
All right.
swear.
Cassidy, I'm on 91.
Yep.
Annie Malone.
Page 91, Annie Malone.
Yep. House on the core.
And then House
And then they had
NDI.
a $500,000 addition there. We'll go with the house on that. That's fine.
Page 92, Cash Assistance, no core changes.
No core changes. Go with the house.
Page 93,
Road
Mattie
Center.
Road Center, no core changes.
Yep. House and close.
Page 94, The Village, no core changes.
So we can go with the house on the core. Then we've
And then a
got,
House NDI.
yeah, I'll go with the governor on that. And then I've got a new section. I've got a new section down here, 11182 for Family Connection Centers in Joplin, St. Louis City, St. Louis County, and also Kirksville at 1.5 million. So that would be roughly $375,000 a piece, right? Okay.
Yes.
Perfect.
Page 95, Chris Harris Foundation, no core changes.
House on the core.
And then a
we've
House
got-
NDI.
Yep, take a Senate position at $400,000 TANF, so we're adding $300,000 to that.
We're on 80.
We're on 95. We're done with that, closed, now we're on 96.
Page 96, Healthy Marriage Fatherhood Initiative,
Yep, no, we're
no
not
core
doing that.
changes.
Senate, 0. 97.
Page 97,
Powerhouse
Powerhouse
Columbia.
Columbia, no core changes.
Yep, House closed.
Page 98, Adult Supplementation, no core changes.
House and close.
Page 99, St. Louis Society for the Blind.
Sorry, Cassidy. 99.
Page 99, St. Louis Society for the Blind, no core
Yep, house
changes.
and close on that.
Page 100, Alpha Point, no core
house and close
changes.
there.
Page
Nursing
101,
care,
supplemental nursing care.
House and close, the same as Department Gov.
Page
Refugees,
102, appropriation authority not
house and
needed.
close there. Fire
Page
pension
103,
on 103. Go with the governor position on the core,
and then NDI for a rate increase.
Didn't originally the governor have this? No
Uh,
difference between the House and the governor?
No, there's no difference.
Okay, well, we can go with the House on that then. That's fine. Okay. 104.
Page 104, Clay County Parenting Court, no
Yep.
core changes.
House and close on that.
Page 105, blind
Go with the
admin.
House on the core. Then I've got a new section. 11206, Gentleman of Vision, $750,000 TANF on 105. Close that.
Okay.
So now I'm on 107.
Page 107, rehab services for the visually impaired, no core
Everybody's the
changes.
same. Go with the House on that.
Page 108,
Synergy
appropriation not
housing,
needed.
Yep. Go with the House on 108.
Page 109, business enterprises, no core changes.
No core changes. Go with the House on that.
And then
cost to
NDI for-
continue. Everybody's the same. Go with the House on that also. Thank you, Cassidy. Mr. Vice Chair, you see how many times I'm saying go with the House on that? Like a lot. Go ahead. Rich. I don't know what you're talking about. Fitzsimmons making a joke.
Does he know that boy name ain't Fitzsimmons? It's Fitzwater. Does he know that? I'm not gonna point that out, but, Mr. Chair. Mr. Chair. His name, not Fitzsimmons.
Freshman? What do we call him? I don't know what he's called.
He's not a freshman no more.
He's not been reelected.
Oh, okay. He's Fitzwater.
Whatever. Fitz something.
You either freshman or sophomore.
Yeah, you know that football player Shannon Sharp. I don't watch his podcast, but he has, he's such a Lakers fan. When he used to be on ESPN, he'd go, swimming pool, dead pool, some pool, Lakers pie. Yeah, I was like,
think I get to legally do it. I have the real devices in my ear.
Oh my God. All right.
Oh my
Yep.
All right, let's get started on book 3.
Book 3, Part 2 of the Division of Family Support, page 110, Child Support Field
Yep.
Staff and Operations, no core changes.
House on the core. Now I've got
Followed
a
by
center
an
position,
NDI.
middle of the page, adding $25,000 GR, so the new total will be $147,059 on 110. And close on that.
Page 112,
Sorry about
Child
that.
Support Enforcement Call Center, no core changes.
House and close on that.
Page 114, Family Connects Pilot Program, no core
yep,
changes.
no longer needed. House and close on that.
Page 115, Easmo Transportation, no core changes.
House and close on that.
Page 116, National Society of Black Engineers, no core changes.
So we can go with the house on that, and then I'm going to put $250,000 TANF in there, and close on that.
Page 117, Appropriation Authority not needed.
Okay, house and close there.
Page 118, Child Support Enforcement Reimbursement to Counties, no core changes.
House on the core, and then I've got a new section under here, Cassidy 11231 for full employment counseling in Kansas City at $500,000 TANF.
Yes.
Okay, thank you.
Page
And
119, Youth Build Works Program, no core changes.
Again, we can go with the house on that, and then I've got an NDI, Youth Build Works, Operation Restart in St. Louis, $750,000 GR. It's not here either. And close on that, 120.
Page 120, Corey Johnson Foundation, no core changes.
House, close on that.
Page
Wait.
121, Child Support Enforcement Distribution Pass-Through, no core
House and
changes.
close on that, 42 million.
Page 122, Community Service Leagues Drop-In Center, no core changes.
House and close there.
Page 123, Child Support Enforcement Debt Offset Escrow, no core
House and
changes.
close there. St. Paul Mentoring Program on 124.
Appropriation
House and
not
close
needed.
there.
Page 125,
Health.
Generate Health, no core
Yep.
changes.
House and close there.
Page 126, Office of Workforce and Community
Yep.
Initiatives, no core changes.
Everybody's the same. House and close there.
Page 127,
127.
Community Services League and Independence.
Yeah, let's do a Senate position of $1 million GR, so we're adding $900,000 to that. 127, and close on that. Thank you,
Page
Cassidy.
128, Community Assistance Council in Kansas City, no core changes.
House and close there.
Page
Project 360
129,
Youth Services. House and close on that.
page 130, Community Assistance Council Building in Kansas City, no core changes.
House and close there.
Page 131, Emergency Solutions Grant Program, appropriation not needed.
Yep. House and close there.
Page 132, Community Partnerships.
Go with the house on the core, and then we've got an NDI here for $5 million on that same line. So 132. Add $5 million to that and close.
Page 133, Missouri Mentoring Program, no core changes.
House and close there.
Page 134, Adolescence Program, no core changes.
We can go with the house on that. And then I've got another NDI 11250 Community of Hope 210,080 GR. And close on 134. 135.
Page 135, Manasseh Ministry, no core changes.
Yep. Go with the house on the core. Underneath
Followed
there,
by-
we got a Senate position at 500,000. So we're adding what? 180,000.
Yes.
Okay. And close on 135. 136.
Page 136, iPoor Life Program, no core changes.
Hang on one second, Cassidy. Go ahead, Cassidy. I'm on 136.
Page 136,
Go with the
iPoor
house
Life
on the
Program.
core there, and then
A House NDI of one-time funding of 250,000.
do what? Sorry.
I'm just saying it's one-time funding.
Yeah, so we're going to remove that on the one-time designation, and let's make it $800,000. So we're adding $550,000 to that 250. On that, then I've got two new sections underneath there. 11253 Welcome House in Kansas City at $1 million for GR, and then 11254 for Elevation Workspace. It's around Kingsway Development, I think, for $250,000 GR. And close on that.
Page 137.
I'm
137.
sorry. I just
Senator
want to
Washington.
verify. Welcome House is at GR.
Yes.
I'm looking. Yes. Yep.
Thank you.
Yep. 137.
No longer needed.
Okay. House and close on that.
Page 138, SNAP employment training, skill
Yep.
up.
House and close there. Hi, Sarah.
Page 139, SNAP adult high school,
House and close.
followed by a governor NDI for
Yep.
high
And
school
the house and
operations,
did the same thing. Go with the house on that.
and then a house NDI.
Same. House and close on that. 140.
Page
Adult high
140,
school.
adult high schools, no core changes,
House and close on the core.
followed by a governor NDI
Operations. Everybody's the same. Go with the house.
and a house NDI.
Yep. Use TANF. Go with the house on that. 141.
Page 141, adult high school expansion, no core changes.
House and close there.
Page 142, adult high school childcare. This was a house core transfer from DESI.
Okay, go with the house on that. That's fine. 143.
Page 143, summer jobs program, no core changes.
House and close there.
Page 144, JAG, no core changes.
Yep. Go with the house. And then let's do a NDI underneath there. $350,000 TANF.
Okay.
So that'd make it 4.5 million, right?
Yes.
Okay. Perfect. Thank you, Cass. 145.
Page 145, community work support. There was a house reduction on laps.
Yep. Go with the house. That's fine. 146.
Page
Foster care
146,
jobs.
no core
House.
changes.
Everybody's the same.
Page 147, employment connection program, no core changes.
That's fine. Go with the house, and I got an NDI here, adding $1 million to TANF. So it'll make it 2.
Yeah.
And close on that. 148.
Page 148,
Mocan
Mocan
Institute.
Institute, no core changes.
House and close on that. Mission
Page
St.
149,
Louis.
Mission St. Louis,
Go with the house on the core.
and a governor NDI.
Yeah, go
The
with
house
the
made
governor.
it one time.
Yeah, go with the governor. Make it ongoing. Where are? Oh, go ahead, Senator.
So that'll be for the 750, correct?
I'm on page 1. We just finished 149.
Right, for Mission St. Louis.
Mission St. Louis. Yeah, it's 2 million,
Okay.
but the house had a one-time designation. We're removing that one-time
Okay,
designation.
make it ongoing.
Yep.
All right, thanks.
You bet. 150.
Page 150, Southside Early Childhood Center, no core changes.
Yep. House on that. 151.
Page 151, Megan Meyer
Meyer
Foundation, no core changes.
We can go with the house on core and then put $350,000 TANF back in there. Senator May. Yes. Hang on 1 second, Cassie. Ready when you are.
Okay. Page 152,
Yep.
Guadalupe Center in Kansas City. This
Yep.
was a governor
Go back to the
NDI.
Go back to the governor. And again, the House put that one-time designation on there, and
Yes.
we're removing that.
Mm-hmm.
Thank you. 153.
Page 153,
Access
Access
Point.
Point. This was a governor new decision item. The House made it one time.
Yep.
And a
We're making it
fund switch.
ongoing. Go back to governor. 154.
Page 154, United Ways, no core changes.
House and close there.
And a House NDI of
Yep.
5 million.
5 million. House and close on that.
Page 155, Capable Kids and Families, no core changes.
House there and close.
Page
I'm on
156,
156.
Great Jobs, Kansas City. This was a
Yeah,
House
let's
new
go with the
decision
Senate.
item.
Let's go with the Senate position and add $500,000 to make that an even million. Then I've got 2 new sections: 11,258 for the Adair County Family YMCA at 1.3 million GR, and then 11,259 the Hope Foundation at $250,000 in GR. And that'll close 156. 157.
Page
Journey
157,
Foundation,
no core changes.
$500,000. Go with the House on that. Community
Page
Partnership of the
158,
Ozarks.
Community Partnership of the
Again, let's
Ozarks.
take a Senate position here, Cassie, on 158 for the community partnership and add $500,000, so it'd be an even million. So, thank you.
Mm-hmm.
And close on that, 159.
Page 159, Temporary Assistance, no core changes.
Go to the House on that, and close.
Page 160, Living with Purpose, no core changes.
House and close there, 161,
Page-
Save Our Streets. We can take the House on the core, but then let's do an NDI of $1.5 million budget stabilization. And close there, 162.
Page 162, Boys and Girls Club of Poplar Bluff.
Again,
no core
we can take
changes.
the House on the core and then add an NDI of $1 million GR, so. 163.
Page 163, Camby's Markets, no core changes.
Yep, House on the core, and then let's add an NDI $500,000 for TANF on 163. And close. Hang on 1 second, Cassie. I'm on 164.
Yep, page
Cassidy?
164, Lyrics Institution, no core changes.
Okay, house and close.
Page
Arts.
165, Arts Tech, no
Arts
core
Tech.
changes.
We can go with the house on the core, and then I got two NDIs, Urban K-Life for $100,000, and Boys and Girls Club of Kansas City at $200,000. And close on 165. 166.
Page 166, Diamond Diva Foundation, no core changes.
House and close. Doorway St. Louis on the next one. Go back to Governor on that one. 168.
Council of Churches
Churches.
of the Ozarks,
Go
a
with
house
the
NDI.
on that. Nope.
On
Senator.
167, we went with the house on 167.
I think we went with the Gov. Let me turn back the number of pages. Go with Gov. Yep. Governor. 169.
Page 169, Diamond Diva Foundation, no core changes.
Yeah, we can do house on the core, and then I got a new section under here, 11269 for Haven House in Poplar Bluff at $100,000. GR. I'm on 170.
Page 170, Rose of Sharon,
Ministries. They've got
no core
house-
changes.
Yeah, the house. That's fine. Go with the house on that. Hey, Representative.
Page 171, Out of School Enrichment, no core changes.
Okay, house and close on that.
Page 172, Good Dads, no core changes.
House and close on that.
Followed by a House NDI for additional funds.
Yep. House and close there.
Page 173, Alternatives to Abortion, no
Same.
core
Go with the house
changes.
on that. We got an NDI from the House for $4 million, and Gov recommended that's fine.
And then at the bottom of that page, another NDI for awareness increase.
That's fine. 275,000. So house and close on that. 174.
Page
Producer resource
174,
grants.
no core changes.
House and close there. Then 2
Followed by
million
an House
underneath that.
NDI.
That's fine. House and close on that.
Page 175,
Cape
Pregnancy
Girardeau,
Resource Center and
$500,000. Yep. House and close on that. 176.
St. Paul Mentorship Program, no core changes.
House and close there. Then they put $126,000 in that thing, which is fine. House and close on that.
Page
Saving our
177,
children. Yep. House and close.
page 178, All Hands on Deck, a House NDI.
Yeah. Go back to Governor on that. And then I've got a new section 11292 for Red Circle in St. Louis at $1 million. And close on 178. 179.
Page 179, Community Services Block Grant, no core
Everybody's
changes.
the same. House and close.
Page 180, New Growth Transit, no core changes.
House and close there. And then the West Central Action, I've got a Senate position at $3 million, so we're adding $1 million there. And close on 180. 181.
Page 181, Impact 100, Crawford County, no core changes.
That's fine. 100,000. House and close.
Page 182, Missouri Empowerment Project, a House NDI.
Yeah, let's take a Senate position at 600,000, so we're adding 450,000 to that line on 182 and close that.
Page 183, Raytown Emergency Assistance Program,
Go
a
with
House
Gov.
NDI.
And close.
Page
Food
184,
distribution
food.
programs, go with the House on that, 10.5 million.
Page 185, Energy
Emergency
Assistance.
assistance, go with the House on that, they're the same as the Gov and the department.
Page-
Bellefontaine Neighbors,
no core changes.
186, yep, House on that, and close.
Page 187, St. Louis Habitat for Humanity, no core changes.
250, House and close on that.
Page
Domestic
188,
violence, 188,
no core
everybody's the
changes.
same, House and close.
Page 189, Emergency Shelter Services, no
Yep.
core changes.
House and close there. Shelter for women on, I'm on 190.
Page
everyone.
190, Women's Shelters with
Yep.
Substance
House
History.
and close there. 191. We can take the
Okay.
house on the Giving Hope core and then add an NDI at $50,000 on that. So TANF. And close on that. 192.
Catholic Legal Assistance Ministry, a House NDI.
That's fine. House and close there.
Page 193, Kathy J. Wyman Shelter, no core changes.
House and close there. And then we got a $250,000 federal fund underneath that. House put in. That's fine. House and close there. I'm on 194. Victim of crime admin. Course,
194.
all the same. Go with the house on that. You got the pay plan mileage underneath there, and then I've got an NDI at the bottom of 195, 11331. Kids in the middle, $200,000 on that NDI, and close on that. 196.
VOCA program, no core changes.
Yep. House
Followed
and
by an
close there.
NDI for a GR pickup.
25 million. House and close on that. And
Page
then we got-
197, assist victims of sexual assault, no
That's
core
fine. Go with
changes.
the house on the core, and then the last one, they had a one-time on this, and we'll keep this. We'll keep the house amount, but let's remove the one-time designation. Thanks, Cassidy. All right, I'm getting ready to start on book 4.
Book 4, Children's Division, page 198, CD admin, no core changes.
House and close on that.
Page 200, Child Abuse and Neglect Hotline Unit, no core changes.
House and close there.
Followed by an NDI for
200.
additional FTE.
Yep. House and close on that.
Page 202, Children's Field Staff and Operations. The House made a reduction of 3 FTE.
Of 3 FTE. Yep. Now, house and close on that. That's fine.
Okay.
Staff training, middle of the page. Go with the house there. Bottom of 202.
Health Info Specialist,
Yep.
NDI.
House and close on that. Cassidy. Then we got
Middle of page
203.
203.
Yep.
The House moved this NDI to a different
Other
section.
section. Yep. House and close there. Got care portal. $250,000. House and close on that.
Okay.
I'm on 206.
Page
Sanctuary
206.
review. Yep. House.
This was one of the NDIs that got moved.
Yeah.
Okay.
House and close there.
Page 207, Bachelor of Social Work, another NDI that was moved to this section.
House and close on that. 208.
Page 208, Diligent Search, no core changes.
House and close there.
Page 209, Family Centered Services, no core changes.
House and close on that. I'm on 211. Team decision making.
No core changes.
Everybody's the same. Yep. House and close there.
Page 213, CCWIS System Faces Replacement, no core changes.
Yeah, that's fine. We can go with the house on the core, and then I've got an NDI here, 11383 for Child Welfare Training Center in Kansas City at $1.5 million. We are on 213, and it's done. 214.
Page 214, Children's Division Staff Training Admin.
House and close there. Then we got training on the next page, 215. House and close on that.
Page
Everybody's the
216,
same.
Staff Training Special
Yep.
Investigations.
House and close there.
Page 217, CD Prevention, Trafficking, and Exploitation, no core
House and close
changes.
there. 218.
Prevention of Human Trafficking, no core
Go with the
changes.
House on that.
Page 219, Prevention of Human Trafficking Grants, no
House
core
and close
changes.
there. We got a management contract on 220.
No core changes.
Yep. House and close there.
Page 221, Brief Strategic Family Therapy.
Yep. House and close on that.
Page 222, Parent-Child Interaction Therapy.
Yep. House and close on that.
Page 223, Birth Match Program, no core changes.
House on the core. Pay plan.
Page 224, Children's Treatment Services, no
Yep.
core changes.
Go with the house on that. 225.
Crisis Care, no core changes.
You can go with the house on the core, and then I've got a new section, 11406, the Lincoln County Resource Board at $100,000. General revenue. And close.
Okay. Page 226, Live to Give Hope, no core changes.
Go with the house on the core, and then NDI $250,000 TANF on that, and close.
Page 227, Kinship
Kinship
Care,
Care.
no core changes.
House and close there.
Page 228, Kinship Navigator Program,
Yep.
not needed.
House close.
Page 229,
Drug
Court Order
testing.
Drug Testing, no core
Everybody's the
changes.
same. House and close.
Page 230, Family First Community
Yep.
Setting Grants, no core changes.
Okay, house on the core.
Followed by an NDI
Yeah, the house.
of one-time funding.
Got it. Just go with house on that. That's fine. 231.
Page 231, Family First Community Setting Contracts, no core changes.
House and close. 232.
Page 232, Family First Development Startup
Yep.
Prevention, no core changes.
House on the core.
Followed by an NDI.
A million. That's fine. Go with the house. 33.
Page 233, Family First Other Expenses and Equipment, no core changes.
House and close there. Foster care
Page
pilot.
234, Foster Care Technology Pilot
House and
Program,
close there. We got Kansas City Child Advocacy Center. House and
no
close
longer
on
needed.
236. Foster care.
Huh.
Core's all the same. Go with the house.
And
FMAP
then-
adjustment. Go with the house.
And this will be in multiple sections. You want
Do
to
what?
take a, FMAP
Yeah,
will be
that's
in
one of
multiple
those global
sections.
deals. Yep,
Yeah,
yep.
okay.
You're right. 237.
Page 237, Foster Care Outdoor Program, no core
Yep.
changes.
Go with the house there, and then I've got a new section for Coyote Hill Foster Care Ministries at $1,050,000 GR on 237. 238. Close that.
Page 238, Foster Care Maintenance Payments,
Yep. Go back to governor on those.
and an
So it'll
NDI,
be, yep. Same governor on middle of 238, 239.
followed by FMAP. Page 239, Therapeutic Foster Homes,
Yep.
no core changes.
House, everybody's the same.
Page 240, the QRTP non-IMD, no core changes.
House and close there. Hey, Brent.
Page 241, QRTP IMD, no core changes.
Yep. House, everybody's the same.
Page 242, residential treatment services, no core changes.
House and close.
Page 243, foster parent training, no core changes.
House and close.
Page 244, foster parent support, no
Everybody's
core
the same. House
changes.
and close. Foster youth education assistant. House and close.
Page
Foster care case management
246,
contracts. House and close.
page 247, adoption subsidy
Go with
payments,
core. House.
and then an NDI
Cost
in the middle of that
continue.
page,
House.
followed by
FMAP
FMAP. Page,
adjustment, which level? House.
yep, page 248, guardianship subsidy payments. No changes between the
Everybody's
governor and the
same on
House.
Core, go with the House. Cost to continue, again, House, same as Gov and the department, and then the FMAP is obviously the House.
Page 249,
Kinship
kid,
Navigator,
no core changes.
House. Family Resource Centers I'm on 250, everybody.
Yep, page 250, family resource centers, no core changes.
House on the core.
Followed by an NDI for additional funding.
Yeah, another 750,000 that the House put in there. So, House and close.
Page 251, behavioral intervention, no core changes.
House and close on the core.
Page
Wright
252,
County,
FRC.
300 grand, House and close there.
Page
Cape Girardeau,
253,
$500,000, House and close there.
page
Transitional living,
254, no core
everybody's
changes.
the same, House and close. Independent Living Center.
Page 255, independent living placements, no
House
core
and
changes.
close. Good Samaritan Boys Ranch, the House put another, what, $500,000 in that? That's fine. House and close. Child
Page
Assessment Centers,
257, child assessment centers, no core changes.
House and close on that.
Page
Sexual
258,
exploitation.
CAC's prevention of sexual exploit, no core changes.
Yep. House and close.
Page 259, a child assessment center in
Yeah, go
Greene
back to
County.
Governor on that one. And close.
Page 260, the 4E authority in juvenile courts, no core changes.
House and close.
Page 261, 4E authority CASA training, no core changes.
House and close there. Child abuse
Page
and neglect
262, child
grants. Core's all the
abuse.
same.
Yes.
House and close there. You got
Followed by an NDI, the House made it one time.
Oh, let's just remove the one time.
Okay. So governor on that one.
Yep. Go back to the Gov.
Followed by mileage. Page 263, foster care children's accounts admin contracts.
Gov on that.
And page 264, foster care children's accounts.
Same. Go with the Governor on that.
Okay.
All
Book
right, I've
5.
got on book 5, the House, they didn't change anything, did they?
Yeah, there was no changes between the
So,
governor and the rec
again-
and the House rec.
We can't seem to find a thick book that we can make this announcement on, but we're taking the House position on these.
On the division
6
of youth
pages.
services. Yes.
All right, I'm on book 6.
Book 6, Division of Missouri Health Net,
Yep.
page 271, MHD admin. The House made a reduction of estimated lapse.
That's fine. House, close on that.
In the middle of page 271, I have an NDI for diagnosis-related
Yep.
groups.
House, close there.
Page 273, clinical services management, no core changes.
House and close on the core.
Page 274, MHD transformation, no core changes.
Go with the House on the core.
Followed by an NDI for Medicare enrollment team.
Yeah, let's do a Senate position here. 502,397 and 7 FTE GR, which would be a reduction of about $215,313 and 3 FTE. We're moving, just for everyone's benefit here, we're moving 3 FTE to DHSS under this line. So. 276.
Page
Cassidy.
276, data management office, no core changes between the governor and the House.
House and close.
Page 277, third-party liability contracts, no core changes.
House and close.
Page 278, information systems, no core changes.
House and close.
Followed by an NDI for the MMIS enhancements
House and close.
and an NDI for the MMIS Fed pickup.
Cross continue, pick up.
And then bottom
House.
of page 278, top of page 279.
Yep. House and close there.
Middle of page 279, operational cost increase.
Operational cost increase of about $8.5 million.
Mhm.
Figured. House and close.
Also in the middle of that page, MMIS PMO NDI.
Yep. House and close there. Bottom of the page.
Page 279, prior.
auth. Yep. House and close on that.
And then top of page 280, NDI for security risk assessment.
Hang on one second, Cassie. Wait one second, Cassie. You ready?
Yep.
All right.
Top
Sorry.
of page 280, NDI for security risk assessment.
House and close on that.
Page 281, MMIS business intelligence. No
House and
questions.
close. It's all the same.
Middle of
Middle
page,
of the page, same way. Enhancements, house and close.
and then bottom of that page, NDI for operational cost increase.
House close.
Page 282, MMIS beneficiary support,
House and close.
followed by an NDI for operational cost increase.
Yep. House close.
Page 283, MMIS is, CMSP, no core changes,
House and close there.
followed by an
Cost-
NDI.
Yep. House and close there.
Page
Pharmacy
284,
Solutions, house and close on the 15 million. Minimize contract management tool, house and close are the same.
page 286, closed loop social service referral
All
platform,
the same. House and close on the core.
followed by a house NDI.
House NDI. Look at that. Go with the house and close on that. 287.
Page 287, health data utility, no core changes.
House and close.
Page 288, show me home, no core changes.
House and close on that.
Page
Pharmacy.
289, pharmacy.
Yeah, almost $2 billion here. Go with the house on that. Pharmacy gov in the middle of the page. Pharmacy specialty, governor. and,
Bottom of that page and top of the next page.
House. And then the FMAP adjustment again, that's
Okay.
house.
Page 291, pharmacy clawback,
House and close there. Same
followed
as
by an
department.
NDI for the cost to continue.
Yep, 30 million, house and close.
Page 292, the Missouri RX plan.
House on the corner, I've got a new section here, 11706 for the RX outreach at $100,000 GR. And close.
Page 293, pharmacy FRA payments, no core changes.
House and close.
Page 294, physician services, no changes between the governor and the house.
Okay, house on the core.
Middle of that page, an NDI for the cost to continue.
Cost to continue, go with the house there, and then FMAP adjustment is the house, and I've got an NDI for anesthesia rate increase at $1,028,897. That would take them from about 51 to 63% of the Medicare conversion, I believe. And close on 294. 295.
Page 295, no longer needed.
Okay, house and close. 296.
Page 296, trauma treatment for children, no longer needed.
House and close there.
Page
CCBHO
297.
4. Go with the house at the top of 297.
Followed by an NDI for the ABA
Cost to
services.
continue. Go with the house. GR
And then-
pickup.
Mhm.
0. House and close on that one.
And then near the bottom of that page, cost to continue NDI.
Yep. House and close that. It's all the same.
And then
FMAP
FMAP.
adjustment again. House.
Page 299, PACE,
House and close on that.
followed by a rate increase.
Right. Slight rate increase. House and close there.
And then the
Cost
cost
to
to continue.
continue. House. FMAP adjustment. House. 300.
Page 300, dental services,
Core.
No
Everybody's the
changes
same. Go
between-
with the house.
followed by a cost
Cost
continue
to
NDI,
continue, house on that, 558,000.
and then
FMAP
FMAP.
adjustment, house again.
Page
301.
301, premium payments.
Slight reduction from the house, 7 million. Go with the house on that.
Followed by an NDI for a premium
Yep,
increase.
28 million house and close on that. FMAP adjustment again, that's the house, 302.
Page 302, no longer needed.
Okay, house and close there.
Page 303, nursing facilities. No changes between the governor and the House.
House and close on that.
Followed by the cost continue
Yeah, let's
NDI.
do a Senate position, back to GR. Let's restore to the governor rec, so it'd be 118,502,637 total, right?
Yes.
Perfect. And close on that.
Okay.
FMAP adjustments, the house, 304.
Page 304, nursing facility value-based payments. No changes between the governor and the House.
House and close.
Followed
Nursing
by an
facilities
NDI.
rebase, house and
FMAP.
close, same as the gov's rec. FMAP
Page
adjustment,
305,
house, 305.
Home health. The House made a reduction based
Yeah,
off of
about-
projections.
800, yeah, that's fine, house and close. FMAP adjustment, house. Nursing facility.
Page 306, nursing facility provider tax. No core changes.
Yep, house and close there,
Page 307, assisted living facility rehab services. No core changes.
house and close on that, 308.
Page 308, long-term support payments. No changes between the governor and the House.
House on the core, then we got the FMAP adjustment again, so that's house.
Page 309, rehab
Rehab
and
specialty
specialty
services.
services. No changes between the governor and the House.
Okay, go with house on the core,
Followed by a rate increase.
yep, house there. Next one,
And then a
cost
cost
continue, we got
continue.
a Senate number here again, restoring, GR to the gov rec at 70,320,159. And then I've got, one NDI for air ambulance rate increase at 441,815. Cassidy, and then the only other thing on that page is that FMAP adjustment, we're going with the house on all those, so. 311.
Page 311, non-emergency medical transportation. No changes between
Everybody's
the
the
governor
same,
and the
go with
House.
the house.
Followed by the,
Actual increase, go with the house.
and
Cost to
then
continue, house, FMAP house. 313.
page 313, ground emergency medical transportation. No changes between the governor and the
House
House.
and close, FMAP adjustments, so that's house.
Page
314.
page 314, complex rehab technology products. House made a reduction based off of estimated projections.
Yep, that's fine. House and close.
And then
Cost to
NDI.
continue, FMAP, both house.
Page 315, managed care.
Yeah, I think we need to send a position here to go back to the governor's position on this page. Do we not?
Just the 85 million fund switch.
85 million on the fund switch reduction that the House did, so, okay, let's do that. So let's do a Senate position on the core, restoring that 85 million. And then there's a GR pickup on the one time, go with the governor on that one.
And then,
Actuarial increase, go with the governor on that one.
and then parity payments.
Yeah, that's fine, go with the House.
And then the
Back to the
fund switch.
gov on this
the-
fund switch, yep.
And
Then I'm
then
at the
followed
top
by
of
FMAP.
316. Everybody's the same there, go with the House there, and then I've got an NDI for air ambulance rate increase at 132,272. Cassidy.
Yep.
And close out 316.
Page 317, managed care general plan GMT services. No core
House
changes.
close. Hospital and clinic project. House and close. And then I'm at 319 with a couple of NDIs. Kirksville Hospital, Hannibal Regional Healthcare, 15 million GR. The Boot Hill Healthcare Foundation in Dunklin, Pimscott County at 25 million GR. Ozark Healthcare, West Plains, $2 million GR. The Citizens Memorial Hospital in Bolivar, 57, 1 million GR. The Missouri Delta Sykeston, I think this is GR. Let me make a note here. I think this one's GR also. 2,037,000. And the Community Health Center in St. Louis City downtown is $3 million general revenue. That should close out 319. 320.
Page 320, no
Super
longer
clinic,
needed.
no longer needed. It's like a clinic, but it flies, right,
Mm-hmm.
Adam?
Page 321, Phelps Health ER, no core changes.
Phelps Health. House and close on that. 322.
Page 322, pediatric pilot program, no longer
House
needed.
and close on that. Managed care.
Page
special
323,
plan. Go with the house on the core.
and then
Back with the gov on the
actuarial,
actual increase.
NDI for the cost continue.
Yeah, go with the house on the cost to continue. Then you got the FMAP adjustments. So that's house. 325.
Page 325, managed care specialty plan, GEMT services, no core changes.
Yep. House and close on that.
Page 326 and 327 is the health clinics, no longer needed.
Okay, house and close there.
Page 328, hospital services.
Go with the house there.
And then a
OPFS
OPFS trend NDI.
House on cost to continue, go with the house. FMAP adjustment, house on 328, 330.
Page 330, torch, no core changes.
Okay, house and close.
Page 331, physician payments for specialty net
So I think we can
hospitals.
take the house on the core here, and then I've got a new section 11793 for indirect medical education, university health at 19,709,102. And that'll close 331.
Page 332, FQHC's distribution, no core changes.
Fine, house and close.
Followed by an NDI for physician
House and
scholarships.
close. Women and minority outreach, house and close.
Page 334, substance abuse prevention network, Jordan Valley.
I gotcha. 334, sorry. That's on a
No
sidebar
core
with
changes?
Yeah. Ranking minority member over here. Yep. 335.
Page 335, substance abuse prevention network, no core changes.
Everybody's same, house and close. Safety net hospital, house and close.
Page
Technical assistance
337,
contracts, house and close there.
page 338, health homes,
Yep. House and close on the core.
followed by the cost to continue NDI,
House,
and then
Primary-
a primary care NDI.
house. Then we got an FMAP adjustment, house. So I'm on 340.
Page 340, children with medically complex conditions, no changes between the governor and the House.
House and close there. Got an FMAP adjustment, so that's house.
Page 341,
Reimbursement
FRA,
allowance. Yeah. We all see why that FRA is important now. $1.6 billion. House and close.
followed by an NDI.
Yep. House close there. 342.
Page 342, CHIP, no changes
Yep.
between the governor and the House.
House on the core. Let's go back to the governor on the actuarial increase. Governor on the pharmacy non-specific PMP, and Gov on the bottom of 342, top of 343. We got
And then the middle of
cost
that,
continue. Go with the house on that, and then an FMAP house.
page 344, CHIP GEMT.
Everybody's the same. Go with the house. Show me babies on the top of 345. Go with the house. Actuarial increase. Go with the Gov. Pharmacy. Go with the Gov. Pharmacy specialty. Go with the Gov. And then again, we got cost to continue. House. FMAP house. 347.
Page 347, school district medical claims, no core changes.
Everybody's the same. Go with the house. 348.
348,
Blind
blind
pension,
pension, no core
Everybody's
changes.
same on the core. Go with the house. And we're going back to the governor on pharmacy and pharmacy specialty. And then
The cost to continue.
cost to continue. Go back with the house. Yep. Perfect.
Page 349, adult expansion group, no core
Everybody's the same on
changes.
the core. Go with the house on that. Governor on the actual increase. Pharmacy non. Go with Gov. And then Gov on the specialty pharmacy line, and then NDI here for the air ambulance rate. Keep all that stuff consistent at 320,025. And close.
Page 351, AEG, Missouri maps, no core changes.
Everybody's the same, right, Cassidy?
Yes.
Go with the house and close.
Followed by an
Cost to
NDI.
continue. Yep. House and close.
Page 352, AEG, DMH, IGT, no core changes.
Yep. House and close there. Cost to
Followed by
continue.
a
House
cons-
and close.
Page 353, GMT services for
Yep.
the AEG, no core
House and close
changes.
there. Transfer on 354.
No core
Everybody's the
changes.
Same. House and close there.
Page 355,
DMH. Yep. Medicaid program, IGT. Go with the house. Everybody's the same on the core. Cost to continue. Go with the house.
and then the rest of this book is just transfers.
It's all transfers, right?
Yeah, and there's no changes between the governor and the House, and no NDIs.
So
for
we
the
can
rest
just take
of
the
this
house
book.
on the rest of the book, right?
Yes.
Perfect. They're all just transfers, folks.
Yes.
So that finishes up book 6. Good job, Cassidy. Thank you. Thank you, Cassidy. Guys, we're gonna take 5 or 10 minutes here. I gotta go get a cup of coffee. I feel like I'm slowing down.
Page 3 is the mansion operating expenses. No core changes.
House on the
Page
mansion.
4 is the National Guard emergency line.
Yep.
No core changes.
House and close on that one.
Page 5 is
Audits.
special audits. No changes.
House and close there.
Page 6 is the $1 ag disaster fund transfer.
Transfer. Yep. House
Then
and
we go
close.
to Office of Lieutenant Governor. There were no core changes on page 1.
Senator Searpoy.
I see on here that it's got 5.7 employees and slated for 8. I've been
Yep.
there For a while, I'd like to see if we can maybe reduce this to 7, reduce his budget by $80,000.
So Senate position, removing 1 FT and 80 grand of PS and the associated probably E&E with that. Yep, no problem.
Middle of the page on 1 is the
Close.
Truman Presidential Library. The House did increase this by $500,000.
House on that and close.
Page 2 in Lieutenant Governor's. Yeah, in this book, you'll notice
Yeah,
the
I was gonna
elected
say, you might-
officials all start over, and that's because of how they print out of the system.
Right. So we're on page 2.
Missouri Arts Council, no core changes.
On the core, go with the House there.
And then there's a new decision item in the middle of page 2 that the
Right,
House
so
added.
Yep. And why don't we do a Senate position there and add $1 million on top of that?
Okay.
So they Senate for 2.
Got it. Page 4 is the public television grants section, no core changes.
So we can go with the House on the core, and then I've got an NDI underneath there, and it's just spending authority, Adam, for $250,000. Is that what you've got?
Yes.
Perfect. Close that. Page 5.
5 is the Humanities Council, no change to the core.
Okay. Let's go with the House on the core.
The new decision item, Springfield Art Museum. The House did not recommend.
Did not recommend. Let's do. Can we do a Senate position there of 750,000?
Got it. The next one in the middle of the page, the House did not recommend.
That's fine. Go with the House on that.
Bottom of the page is an increase for the Negro League Baseball Museum. The
Yeah,
House
again, let's
added-
take a Senate position of that at 1.5 million and close that. And then I've got a couple of other NDIs down here at the bottom. $400,000 for the Buck O'Neill Center, $2 million for the Lyric Opera. Making notes here at the same time. 2.25 for repertory theaters, and $250,000 for Arts Asylum. And close those. I'm on page 6.
Page 6 is an item that the House added for the Churchill Museum.
Yeah, go back to Governor on that one. And close that. Page 7.
Page
Arts Council
7
transfer.
is the Arts Council Trust Fund, no changes to the core.
Yep. House and close that.
Page 8 is the Humanities Council transfer.
Again, let's do the Senate position there of $3,551,667. And then the GR transfer underneath that, Adam, would be a Senate position of $6,650,000.
Okay.
And close on that. Page 9.
Page 9 is the transfer for the public television. No changes to the core.
Okay, let's do House on the core, and then I've got an NDI of $460,000 to increase the GR transfer on that
Okay.
line. Adam?
Next, we move into the Office of the Secretary of State on page 1.
Senator Searpoy again.
Again, on the FTEs, this committee has made an effort the last few years to reduce some of these FTEs. We've never had a department head that was willing to work with us, and so maybe we would do. This department has 63 empty FTEs, many of them have been open for a long time. I thought maybe we could reduce it by 25 and reduce the funding. Across these categories, it's like $784,606 a week.
Okay. We'll make a Senate position there and make those adjustments. And close on that.
Page 3 is grants and projects, no core changes.
Page 3.
Page 3.
Yep.
Page
House and close.
4 is refunds, no changes.
House and close on refunds.
Page 5, there were no changes.
House and close on that.
Page 6, this was transferred to Department of Commerce and Insurance.
Okay. House and close on 6.
Pa-
7.
Page 7 is the
Election
election
public
public notice, the $1. This will not be needed, and it's a placeholder.
Got it. House and close.
Page 8 is absentee ballots. No changes by the
There.
House.
House and close there.
Page 9 is federal election reform, no core changes.
House and close on that. Mileage
Page-
underneath it.
Page
Election cost
10 is,
transfer.
yes.
10, house and close there, nothing changed.
Page
Grants. House and close on the grants.
Page 12, no changes.
House and close there.
Page 13, no changes.
House and close on 13, the document presentation.
Page
We got
14,
Public libraries. Yep.
no
No
changes.
changes, go with the house.
Page 15 is real, no changes.
Okay, go with the house.
Page 16 is federal aid to the libraries, no changes.
House and close.
Page 17 is the library networking fund, no core changes.
No core changes, go with the house.
New DI was not recommended.
Didn't recommend, that's fine, go with the house.
Page 18 is that GR transfer for library networking, no core changes.
House and
And-
close there.
And the new DI was not recommended.
Correct. House and close 19.
Page
Blue
19 is
books.
the blue book, no changes.
Okay, house and close on
Then we
that.
move into the office of the state auditor, no changes on the core.
Okay. House and close on that.
Then we go to page 1, this is the office of the state treasurer, no changes on the core.
Okay. House and close there.
Page 2 is advertising and auctions, no changes.
Yep. House and close on that.
Page 3 is the Missouri Empowerment Scholarship Accounts Program, no changes on the core.
Okay, go with the house on that. The
And
next
there's-
one's the spending authority. Take that down to 0.
Okay.
Senate position. Close on that.
Page 4 is
4.
Treasurer's Information Fund, no changes.
House and close there.
Page 5 is the transfer for the Mo
Right,
Empowerment
so make a
Scholarship.
match and put a Senate position 0 on that. Page 6.
Is duplicate and outlaw checks, no changes.
House and close on that.
Page 7, abandoned fund claims, no changes.
House and close on that.
Page 8, abandoned
Transfer.
fund, yes.
House and close on the transfer.
9, no changes.
House and close on that.
10, no changes.
Link deposit refunds. House and close.
11,
Debt
no
offset
changes.
transfer. House and close.
12, no changes.
House and close on that.
13 was
Charter
was one time,
school,
not
house
needed.
And close on that.
14 is no core changes.
Yep. House and close on public schools, charter schools, CI. House and close on that.
Then we go to the Office of the Attorney General, no core changes.
Okay. House and close there.
We have a couple new decision items that are different,
Yep.
that were recommended by the governor and the House.
Go with the house on the next 3 there. That's fine.
And then we have
Go to
2
Top of page 2.
on top of page 2.
Labor, go with the house on that. And then the solicitor general, go with the house on that. That's fine. Pay plan,
Page 4 is domestic violence section, no changes
go with the
here.
house on that.
Page 5 is violent crime task force, no
House
changes.
there, Medicaid fraud unit.
No changes.
House there, Medicaid fraud again. Middle of page 5, house there. Nothing on 7.
Page 8 is the MOPS division, no changes on the core.
Yep, house there.
A new decision item recommended by the House. In the middle of
That's
page
fine.
8.
Yep. Middle of
House.
page 8, go with the house on that, and then you've got the training underneath there, $7,000, house on that.
Page 10, no changes, that's a transfer.
Attorney General Trust. Yep, go with the house on that, sorry, Adam.
Page 11 is another transfer, no
Transfer,
changes.
No change there, go with the
And
house
12
there.
is a transfer.
House on that transfer.
13 is, this was one-timed on the core, and then the House added $250,000 for this GR
That's fine, go with the
transfer.
house on both of those, and that'll finish the first book there.
Okay. The next book would be Judiciary
Yep,
page, and we're going to see some different new decision items throughout this book. On page 1 is Judicial Proceedings and Reviews, no changes on the core.
house closed there, salary adjustment, go with the house.
Building
Building restoration.
was not
house.
recommended.
Library renovations, go
Was
with the
not
house on
recommended.
that.
Okay. Then you go to
On
page
page 4.
4 is the Supreme Court Justices,
Yep,
House, and then their pay plan.
yep, house, and house on that page.
Page 5,
Go on
State
page
Courts
5.
Administrator, no changes on the core.
Go with the house on the core.
Marijuana Initiative, new DI,
Yep, everybody's the same, go with the house. Oscar.
was not recommended.
Okay, go with the house there.
Data center replacement,
Go back with the governor on that one.
okay.
Security and maintenance, go with the house, the bottom of page 5. Nothing on 6, I'm on
Page
7.
7's the pretrial pilot program,
Everybody's the same, right? House,
yes.
close on that. pretrial program, house on the next one, Oscar to target, house there, I'm done with 7, nothing on 8.
Page 9. Court improvement projects.
Everybody's the same.
Yep, on the page.
House, and close on that. Again, Oscar to target, house, nothing on 10.
Page 11
on
is
11.
statewide court automation. House.
Yep, everybody's,
And then the middle of the page, the data center replacement.
yep, house again. And then governor on the data center on 11. Nothing on 12.
13. Judicial training and ed transfer, no changes, same.
Got it. House, and close on that. GR transfers, house.
14 is the spending authority for that program.
Yep.
Yep, same.
House there on the top 2. Then you got the pay plan, mileage. I'm on 16.
16, this is the Western District Court of Appeals. No changes on the core.
I'll go with the house on core. And then, can we go back to the department request on the Western District Chief Deputy Clerk there, Adam?
Yes, the
Yeah,
20,826.
yeah, yep,
Yes.
yep.
Okay.
So, yep. Then you got the pay plan,
Yep.
mileage.
18 is staff for the Eastern District Court of Appeals.
Okay?
No changes. House and then pay plans. Yep. 19 is the staff for the Court of Appeals for the
Yep.
Southern
House
District.
and close.
20 is the
Western
judges.
District.
Yes, for the
So-
Western.
House on the core. Judge salaries go with the house. Yeah, these are all house positions. On
21
20,
is Eastern
21,
District judges.
Same. House on all 3 of those. Salary adjustments.
22 is for the Southern District.
Same. Yeah, we
Yes.
just have to do them in districts. So, house on 22.
23, we go into the Circuit Division, and this is the personnel staff for the circuit courts.
Right. So,
No
same on the
changes.
core. Both house and core.
Court reporter increase.
House. Salary adjustment for the staff. House.
Juvenile detention
Let's go
staff.
back with the governor on the bottom of 23 for the juvenile detention
Okay.
staff. Then we're on 24.
Circuit target would be House,
Yep.
and then there's
Then the 39th would be the house. Contract would be the house. Pay plan, house. 24th would be the house. 32nd would be the house. 26th and 25th are both house positions, and you got the pay plan and mileage underneath that. I'm on 26, Senator, but you skipped ahead. You're working ahead. Bottom of 26 after the pay plan, I've got a couple of NDIs. 1.1 million for the Greene County courtroom improvements, $750,000 for foster care pilot project, and 3.5 million in IT upgrades for the 22nd Judicial Circuit. On 26, and I would close 26. So now I'm on 27. Now I'm caught up to you,
yeah.
Senator.
27 is the circuit judges and commissioners.
These are all going to be house positions, are they not? I mean, on
Yeah.
27.
Yes, sir.
Yep. So house positions all the way down 27, the top of 28,
Same
and
on
then you get
20.
into the pay plan.
Yes.
Yep. Okay. So now we're on 29.
CASA
CASA.
programs. No changes to the core.
Go with the core. Go with the house with the core. Then I've got an NDI for $500,000 to the Boone County CASA at the bottom of page 29. So, and close that. 30.
30 is a new item added by the House for CASA CI projects statewide.
That's fine. Leave it in there. Go with the house.
31 domestic relations, no changes.
Go with the house there.
32 is Commission on Retirement, Discipline, and Removal, no changes on the core.
House on the core, salary adjustments, you got the house, you got the pay plan, mileage. I'm on
34
34.
is the Appellate Judicial Commission, no changes.
House there.
35
Mileage.
is Treatment Courts transfer.
Yep. The house on the top 2 got a GR transfer on the next line there, 35.
36 is the Spending Authority for the Treatment Courts.
Same deal, house on the top 2 there, then your pay plan and mileage again, and that's it.
Next would be Public Defender. Page 1,
Yep.
Office of the Public Defender, no change. There was a slight core reduction.
300-ish.
Yes.
I gotta go with the house on that, that's fine.
Okay, then we have some new decision items here. The governor and the House did not recommend the mitigation
Yep,
specialist.
go with the House.
There is an increased spending authority.
House there too.
Okay.
I'm on
and
3.
3, page 3, yes, sir. This is extraordinary expenses, conflicts, no changes to the core.
They're all the same. House, close on that.
Page 4 is legal defense and defender fund, no changes on the
House
core.
and close there, close, and you got the pay plan, mileage. I'm on 5.
5 is debt offset escrow, no changes.
Okay, go with the House, close on that.
Page 6 is federal grants,
Core,
donations.
everybody's the same on the core. Go with the House. I'd like to go back to the governor on the spending authority increase that he had in there, middle of the page. So go with the gov on that, close. Everything else the same. Page 7.
This is a new item added by the House.
Yeah, it's fine. Go with the House on that. 3 million.
Page 8
Technology upgrades.
It's another
go with the
item.
House.
and page 9 was added by the House.
Yeah, I think a Senate position on this item of $2,326,080.45 FTE.
Got it.
Okay, thank you.
General Assembly would be the final book in 12.
All right, we got the General Assembly here.
I
Adam?
need a pay raise in this.
Yeah.
Page 1 is the Senate, your salaries.
We would like our salaries to be equal to.
Equal to what? The feds?
Well, that would be fine. I wasn't going to go that far, but I like it. California, New York, Michigan, Illinois, any of those. Thank you.
Any of those bright red states that you just mentioned?
Alabama makes more than us.
Well, do they have 289 members of their House? All right, page 1, Adam.
Page 1 is senator salaries.
Page 1.
No changes on the core.
All right, good. Let's go with the House on that.
And then this is the pay increase.
Yep, House
Okay.
there.
Page 2 is mileage.
Mileage. Yep,
Yes.
it's fine. Go with the
Page
House.
3 is your per diem,
Go with the House.
and they increased it. That goes up every year.
Okay.
Okay. Page 4 is the Senate contingent expense. That's for your staff and the
Okay.
Senate.
Go with the House.
And then the department or the House added $50,000 in general revenue for the ERP staff.
Yeah, let's go back to the governor on that one if you don't care.
Okay. Then we have pay plans.
Yep, and I've got a couple of notes here. $100,000 on the Microsoft 360 licenses that we need to do, and $130,000 adjustments on the director's assistant director salary. So I mentioned this. I know I mentioned this yesterday whenever we started talking about employee pay, and that the administration in their plan had, in my opinion, prioritized their directors of various departments and given them, in some instances, in my opinion, a pretty sizable increase in pay. And I made the comment yesterday that I would like to see us do the same thing. I think if the administration is going to show value in their top brass, that I think we should do the same thing. And so that's what this $130,000 here is equivalent to. So, all right, I'll take that as a Senate position and move on. Thanks, guys.
Page 6 is the joint contingent expense section. No changes.
House will close there.
Page 7, then we move into the House of Representatives. This is their salaries.
Yep. House will close on that.
And then the same new DI
Same
for
deal.
them.
Yep.
Page 8 is their mileage.
Yep. House will close on that.
Page 9 is their per diems and the new
Same
DI
deal.
to increase that.
Yep. House will close on that.
Page
Close.
10 is representative expense vouchers.
Got it. House will close on that.
Okay. Page 11.
Contingent expenses, we go with the House on that. Go back with the governor again. They put $50,000 in that same line they did on our side. We're going back with the governor on that. Then you got the House on the Microsoft 360, right?
Yes.
And then same thing here. We're going to have a Senate position and add $130,000 worth of adjustments for their directors and assistant directors. I'm not treating the directors and assistant directors on the Senate side any differently than we are those on the House side. So everybody's getting similar increases under this recommendation. So House and Senate.
13, House revolving fund, no changes.
Okay, House and close.
Page 14, organizational dues, no changes.
House and close there.
Page 15, this was one time, so not needed.
Okay. House and close on 15. I'm on
Page
16.
16, Committee on Legislative Research Admin. The House did reallocate 172,000 and 2 FTE.
Yeah, let's go back to the governor's recommendation on that, Adam.
Okay.
Then you got, I'm on 17. with
17.
Legislative research and oversight.
Yeah, so we'd have to go gov here.
Go back to the governor on that one also, yep. And then I've got at the bottom of this page an NDI, putting about $60,000 in there. Is that not right, Adam?
Yes, that will be added.
Perfect. 18.
18, a legislative research publisher of statutes, no changes.
Okay. House and close on that.
Page 19
Joint
is
committee.
JCAR,
Yep.
no changes.
House. Close
20
on that.
is retirement, Joint Committee on Retirement.
House and close on that.
21 is Joint Committee on Education.
House and close there.
Page
Capital Commission transfer.
22, the House added back in this transfer that was one-timed last year.
Yeah, that's fine. We can go with the House there, and then let's go back on the Capital Commission transfer underneath that. Go back with the governor on that, right?
Yes.
And 23.
Page 23 was one-timed.
Yep, so we'll go with the House.
Page 24 was a new decision item the House
Added by the
added.
House. Go back to the governor on that one. And then they've got 10 million, they being the House, recommended $10 million on that very last page. I'd like to go back to the governor on that. They were recommended $10 million
25.
for architectural drawings on the Capitol complex. And $10 million seems like a lot of money. Yeah. Dana, I've got the book for House Bill 13 in front of me, real estate.
Yep, real estate, section 13.005 is the leasing.
Yeah, so we got a governor's amendment on this, so it'd be 13005 under the same leasing for adding $1.144 million to GR for warehouse leases in DHSS and DPS. And then similar section 13010, the House, let's see,
Yeah,
what is
and
it?
13010 is house and all, and then 13015 is institutional.
Got it.
We'll go with the governor on the mental health piece, just back to all GR for that line.
Got it.
And then there's the 13020, which is the revolving fund, house on that.
Got it.
And then there's the new decision items at the bottom. The pay plan, of course, we're going
Right.
back to the governor. There's the state warehouse complex.
Go back to the governor on that one.
Okay, and then
The House on the rest. Yep.
and then the
So
second
that's
book
real estate. Yep.
is House Bill 17, which I have some copies here if anyone wants them, and that's for the reappropriations.
Yeah. So yeah, I think everybody on the committee knows this, but House Bill 17 is just a reappro bill. It's all those ongoing projects that just need more time to get completed. And so, in fact, I think you probably heard me mention several times in the last day and a half, the House had actually moved a number of items to House Bill 17, taking them out of the operating bills because they're essentially ongoing projects, and they've stuck them over on 17. So, like the I-70 money was moved to 17, and I-44, like there were some big road projects that were moved to 17. What else? What am I missing?
There were 3 items that
Yeah, so I've
we are
got-
different than the House
Yeah,
on.
the Missouri Valley Youth Services at $2 million, the railroad at-grade crossings. I think folks remember probably that we did that a couple of years ago. We put $50 million, I think, in
Yeah.
for at-grade crossing improvements all over the state. Having a little bit of trouble getting that money spent where it is right now, and so my recommendation is to move a portion of that. I think 20 million is that what we landed on?
Yeah, about 20 million.
About $20 million worth of those already identified projects into 17 to where
Into 19.
into 19. I'm sorry, to where we can hopefully get that money out the door, and then The only other note that I've got here, Dana, is the World Cup capital improvements for $1 million. Is that
Yep,
right?
they didn't get all that spent last year, so,
Right.
yep.
So, be a house on everything else in 17. 'cause,
Correct.
Again, it's a reappropriation of everything.
That you've
But
seen in
it's
the past.
ongoing, right,
Yep.
right. So, if I'm not explaining that clearly, please ask, but it's just a reappropriate.
That's it,
Good? That's it? All right. Thanks, Dana.
this week.
All right, so here's where we are. So that would complete the markup on all the operating bills and these last two, real estate and the reappropriate bill. So we have about, am I close on this, like 85 pages of language that we've got to go through. If the committee would break for just a few minutes, let us put those packages together and then get them distributed and let you guys start looking through them whenever we come back. And that's just, again, Dana or Adam, jump on in if you want, but this is just going to be language that is new. If things have been TAFP'd in the past, we didn't print all of that and resort through it. But these are, you'll see, I think everybody's seen it before, you'll see a lot of descriptions in projects that we itemize in these operating bills that then we got to make sure that the money gets to the right place. So that's what a lot of that language is. But if you'll give us, how much time do you think we need? Half hour? 45 minutes, something like that?
Closer to an hour, probably.
So we'll say 20 minutes, and it'll be 2 hours. And then we'll come back in and see if we can't get through the language and the flex package, and then take action and vote these bills out of committee.
The language be the same computer system with,
Thank God it
Thankfully,
does
no.
not. Thank God it's not using the same computer system, or we'd never see it. And I mean, just a little timeline notice again. So this is Wednesday. When did we get these bills from the House? A week ago Monday. So we've had them about 9 days, and we're going to get them marked up and out of our committee in 9 days. I think that's. I bragged on them a little bit yesterday. Probably not enough. That's a testament to the folks that we have working downstairs. And they're like that. That's it. The fact that they can get these from the House and make these changes and work with all of us and every other, individual or group around here and get them turned around in the time that they do is borderline astronomical, especially considering our computers don't work. So we'll take a recess here for, I don't know, probably an hour, and come back in. We'll shoot for 2 o'clock to come back in and do language, flex, and then vote these things out. Thanks for hanging in there, guys.
It looked like a good plan. It sounded like a good plan.
I mean, I can make it, and I just can't execute. Back to order. Appreciate everyone giving us a little bit of time to put this language and flex packet together. We have distributed that to all the senators. I think we've got a few extra copies around that some folks have. And then also, I believe it is online. Thank you, Dana. It's made available online, the language packet that we're getting ready to go through. And if it's okay with the committee, here's what I was thinking we would do. Because this is all the language associated with changes or additions that our committee has recommended over the last couple of days. And so in this language packet, just take the first section there in DESI, for instance. If there's a Senate proposal for language and there's a House proposal or a recommendation, we're going with the Senate language, okay? If there is, the only time that we would be using the House language is if that's the only recommendation under that subsection. Does that make sense? So any opportunity we have in this, if there's a Senate appropriations proposal, that's the language that we're going with. And I think there's only a couple of instances where there are House and governor recommendations, and we're going with the governor on those. Does that make sense to everybody? It's not a slight at the House. It's just these are primarily things that we have done or added or changed. So then there's associated language with those changes or additions that we've made, or that, like I said, in a couple of instances that the administration has asked for either a governor's amendment or language changes. That makes sense to everybody? So instead of me going through these 86 pages, I would just give you guys a couple of minutes to kind of breeze through real quick and take a look at the things that you care about. And if we don't have any inaccuracies, and we try to do as good of a job as we could, then I think we should be in good shape. And then the flex package, that's probably right behind that at your on your desk, is primarily these are the Senate Appropriations proposal on the flex is primarily what we've worked with the department on and what they've requested. So we went primarily with those. Adam, am I missing anything on the flex?
No, on the flex, I need to make one correction on that. On page 1 under DNR, it's got a Department of Corrections section there. That should be state parks, 10% flexibility.
Okay.
That should be for state parks.
Yeah, and the only other, I think, technical correction on that flex package would be in section 10.780, and that's a 17% flex between GR and Fed funding. Also.
What happened?
And again, just kind of for everybody's clarification, that language that's in front of you, that's going to be what is actually in the physical bill on the floor when we're discussing them. All right. I will make a motion that we go into executive session. Do I have a second? I've got a second. We are in executive session. And now make a motion that we, Adam, are you with me?
Gotcha.
Okay. Now make a motion that we take up for consideration House Committee Substitute for House Bill number 2. Do I have a second? I've got a second. We'll take it up, and I now make a motion that we adopt the Senate Committee Substitute. So if everybody remembers the way this, I mean, this is just like other legislation that you do in other committees. We've got to adopt our Senate Committee Substitute to make the recommendations to the House Committee Substitute on all of these bills, and then adopt the substitute, and then
Second.
so same process, just a little cumbersome because there's a handful of them. So I make a motion that we adopt the Senate Committee Substitute for House Committee Substitute for House Bill number 2. Do I have a second? I do have a second. That Senate Committee Substitute is before the body. Any discussion on that? What?
You should call it.
You want to call the roll? Is that what you said?
No, after each one, you should say all in favor. After
Yeah.
each motion. Even
All right, all those in favor of adopting the Senate Committee Substitute for House Committee Substitute for House Bill 2, please say aye. All those opposed say no. The ayes appear to have it. The ayes do have it. You have adopted the Senate Committee Substitute for House Committee Substitute for House Bill number 2. I now make a motion that we do pass the Senate Committee Substitute for House Committee Substitute for House Bill number 2. Do I have a second?
Second.
I've got a second on the do pass motion. Any discussion on the Senate Committee Substitute for House Committee Substitute for House Bill number 2? Hearing none. Adam, call the roll on the do pass motion for Senate Committee Substitute for House Committee Substitute for House Bill number 2, please.
Yes, do pass Senate Committee Substitute for House Committee Substitute for House Bill 2. Senators Huff. Black. Bean. Brown. Searpoy. Crawford. Fitzwater. Henderson. Hudson. May. Neuenburn. Washington. Williams. That's 13 ayes, 0 no.
By your vote of 13 ayes, 0 no, you voted do pass Senate Committee Substitute for House Committee Substitute for House Bill number 2. I now make a motion that we take up for consideration House Committee Substitute for House Bill number 2. Do I have a second? I do have a second. I now make a motion that we adopt the Senate Committee Substitute for House Committee Substitute for House Bill number 3. I've got a second. All those in favor of taking up for to adopt the Senate Committee Substitute, please say aye.
Aye.
Those to the contrary say no. The ayes appear to have it. The ayes do have it. You have adopted the Senate Committee Substitute for House Committee Substitute for House Bill number 3. I now make a motion that we do pass Senate Committee Substitute for House Committee Substitute for House Bill number 3. Do I have a second?
Second.
I do have a second. Adam, would you call the or any discussion on the Senate Committee Substitute for House Bill number 3? Hearing none. Adam, would you call the roll on the do pass motion?
Yes, to do pass Senate Committee Substitute for House Committee Substitute for House Bill 3. Senators Huff. Black. Bean. Brown. Searpoy. Crawford. Fitzwater. Henderson. Hudson. May. Neuenburn. Washington. Williams. 13 aye.
By a vote of 13 ayes and 0 no, you voted do pass Senate Committee Substitute for House Committee Substitute for House Bill number 3. I now make a motion we take up for consideration House Committee Substitute for House Bill number 4. Do I have a second?
Second.
I do have a second. I now make a motion that we adopt the Senate Committee Substitute for House Committee Substitute for House Bill number 4. Do I have a second? I do have a second. All those in favor of adopting the Senate Committee Substitute, please say aye. Those contrary say no. The ayes appear to have. The ayes do have it. You have adopted the Senate Committee Substitute for the House Committee Substitute for House Bill number 4. I now make a motion we do pass Senate Committee Substitute for House Committee Substitute for House Bill number 4. Do I have a second?
Second.
I do have a second. Any discussion on the Senate Committee Substitute for House Bill number 4? Thanks. Hearing none. Adam, would you call the roll on the do pass motion for Senate Committee Substitute for House Committee Substitute for House Bill number 4?
To do pass Senate Committee Substitute for House Committee Substitute for House Bill 4. Senators Huff. Black. Bean. Brown. Searpoy. Crawford. Fitzwater. Henderson. Hudson. May. Neuenburn. Washington. Williams. 13 aye.
By a vote of 13 ayes and 0 no, you voted do pass Senate Committee Substitute for House Committee Substitute for House Bill number 4. I now make a motion we bring up House Committee Substitute for House Bill number 5. Do I have a second?
Second.
I do have a second. I now make a motion we adopt the Senate Committee Substitute for House Committee Substitute for House Bill number 5. Do I have a second? I do have a second. All those in favor of bringing up the Senate Committee, or adopting the Senate Committee Substitute for House Committee Substitute for House Bill number 5, please say aye. Those to the contrary say no. The ayes appear to have it. The ayes do have it. You have adopted the Senate Committee Substitute. I now make a motion we do pass Senate Committee Substitute for House Committee Substitute for House Bill number 5. Do I have a second?
Second.
I do have a second. Any discussion on the Senate Committee Substitute for House Bill number 5? So way. Hearing none. Adam, would you call the roll on the do pass motion, please?
Senate Committee Substitute, House Committee Substitute for House Bill 5. Senators Huff. Black. Bean. Brown. Searpoy. Crawford. Fitzwater. Henderson. Hudson. May. Neuenburn. Washington. Williams. 13.
By a vote of 13 ayes and 0 no, you voted do pass Senate Committee Substitute for House Committee Substitute for House Bill number 5. And I make a motion we take up House Committee Substitute for House Bill number 6. Do I have a second?
Second.
I do have a second. Now I make a motion that we adopt the Senate Committee Substitute for House Committee Substitute for House Bill number 6. Do I have a second? I do have a second. All those in favor of adopting the Senate Committee Substitute, please say aye. Those to the contrary say no. The ayes appear to have it. The ayes do have it. You have adopted the Senate Committee Substitute for House Committee Substitute for House Bill number 6. I now make a motion we do pass Senate Committee Substitute for House Committee Substitute for House Bill number 6. Do I have a second?
Second.
I do have a second. Any discussion on the Senate Committee Substitute for House Bill number 6? Hearing none. Adam, would you call the roll on the do pass motion, please?
Yes, to do pass Senate Committee Substitute, House Committee Substitute for House Bill 6. Senators Huff. Black. Bean. Brown. Searpoy. Crawford. Fitzwater. Henderson. Hudson. May. Newburn, Washington, Williams. 13.
By a vote of 13-9-0, no, you voted do pass. Senate Committee Substitute House Committee Substitute for House Bill number 6. I now make a motion we bring up before the committee House Committee Substitute for House Bill number 7. Do I have a second?
Second.
I do have a second. I now make a motion we adopt the Senate Committee Substitute for House Committee Substitute for House Bill number 7. Do I have a second?
Second.
I do have a second. All those in favor of adopting the Senate Committee Substitute for House Committee Substitute for House Bill number 7, please say aye. Those to the contrary say no. The ayes appear to have. The ayes do have it. You have adopted the Senate Committee Substitute for House Committee Substitute for House Bill number 7. I now make a motion we do pass Senate Committee Substitute for House Committee Substitute for House Bill number 7. Do I have a second? I do have a second. Any discussion on the Senate Committee Substitute? Hearing none. Adam, would you call the roll on the do pass motion, please?
To do pass Senate Committee Substitute, House Committee Substitute for House Bill 7. Senators Huff, Black, Bean, Brown, Searpoy, Crawford, Fitzwater, Henderson, Hudson, May, Newburn, Washington, Williams. 13.
By a vote of 13-9-0, no, you voted do pass Senate Committee Substitute for House Committee Substitute for House Bill number 7. I now make a motion that we take up for consideration before the committee House Committee Substitute for House Bill number 8. Do I have a second?
Second.
I do have a second. I now make a motion we adopt the Senate Committee Substitute for the House Committee Substitute for House Bill number 8. Do I have a second? I do have a second. All those in favor of adopting the Senate Committee Substitute, please say aye. Those to the contrary say no. The ayes appear to have it. The ayes do have it. You have adopted the Senate Committee Substitute. I now make a motion we do pass Senate Committee Substitute for House Committee Substitute for House Bill number 8. Do I have a second? I do. Any discussion on Senate Committee Substitute on House Bill number 8? Hearing none. Adam, would you call the roll on the do pass motion, please?
Yes, do pass Senate Committee Substitute for House Committee Substitute for House Bill 8. Senators Huff, Black, Bean, Brown, Searpoy, Crawford, Fitzwater, Henderson, Hudson, May, Newburn, Washington, Williams. 13.
By a vote of 13-9-0, no, you voted do pass Senate Committee Substitute for House Committee Substitute for House Bill number 8. I now make a motion we bring it before the committee House Committee Substitute for House Bill number 9. Do I have a second?
Second.
I do have a second. I now make a motion we adopt the Senate Committee Substitute for House Committee Substitute for House Bill number 9. Do I have a second? I do have a second. All those in favor of adopting the Senate Committee Substitute, please say aye.
Aye.
Those to the contrary say no. The ayes appear to have it. The ayes do have it. You have adopted the Senate Committee Substitute for House Committee Substitute for House Bill number 9. I now make a motion we do pass Senate Committee Substitute for House Committee Substitute for House Bill number 9. Do I have a second?
Second.
I do have a second. Any discussion on Senate Committee Substitute for House Bill number 9? Hearing none. Adam, would you call the roll and do pass motion, please?
Yes, do pass Senate Committee Substitute, House Committee Substitute for House Bill 9. Senators Huff, Black, Bean, Brown, Searpoy, Crawford, Fitzwater, Henderson, Hudson, May, Newburn, Washington, Williams. 13.
By a vote of 13-9-0, no, you voted do pass Senate Committee Substitute for House Committee Substitute for House Bill number 9. I now make a motion we take up for consideration before the committee House Committee Substitute for House Bill number 10. Do I have a second?
Second.
I do have a second. I now make a motion we adopt the Senate Committee Substitute for House Committee Substitute for House Bill number 10. Do I have a second? I do. All those in favor of adopting the substitute, Senate Committee Substitute, please say aye. Aye. Those to the contrary say no. The ayes appear to have it. The ayes do have it. You have adopted the Senate Committee Substitute for House Committee Substitute for House Bill number 10. I now make a motion we do pass Senate Committee Substitute for House Committee Substitute for House Bill number 10. Do I have a second?
Second.
I do have a second. Any discussion on Senate Committee Substitute on House Bill number 10? Hearing none. Adam, would you call the roll on the do pass motion,
To
please?
do pass Senate Committee Substitute, House Committee Substitute for House Bill number 10. Senators Huff, Black, Bean, Brown, Searpoy, Crawford, Fitzwater, Henderson, Hudson, May, Newburn, Washington, Williams. 13.
By a vote of 13-9-0, no, you voted do pass Senate Committee Substitute for House Committee Substitute for House Bill number 10. I now make a motion we take up for consideration for the committee House Committee Substitute for House Bill number 11. Do I have a second? I do have a second. I now make a motion we adopt the Senate Committee Substitute for House Committee Substitute for House Bill number 11. Do I have a second? All those in favor of adopting the substitute, please say aye. Those to the contrary say no. The ayes appear to have it. The ayes do have it. You have adopted the Senate Committee Substitute. I now make a motion that we do pass Senate Committee Substitute for House Committee Substitute for House Bill number 11. Do I have a second? I do have a second. Any discussion on the Senate Committee Substitute for House Bill number 11? Hearing none. Adam, would you call the roll on the do pass motion, please?
To do pass Senate Committee Substitute, House Committee Substitute for House Bill 11. Senators Huff, Black, Bean, Brown, Searpoy, Crawford, Fitzwater, Henderson, Hudson, May, Newburn, Washington, Williams. 13.
By a vote of 13-9-0, no, you voted do pass. Senate Committee Substitute for House Committee Substitute for House Bill number 11. I now make a motion we take up for consideration before the committee House Committee Substitute for House Bill number 12. Do I have a second?
Second.
I do have a second. I now make a motion that we adopt the Senate Committee Substitute for House Committee Substitute for House Bill number 12. Do I have a second? I do have a second. All those in favor of adopting the substitute, please say aye. Those to the contrary say no. The ayes appear to have it. The ayes do have it. You have adopted the Senate Committee Substitute. I now make a motion that we do pass the Senate Committee Substitute for House Committee Substitute for House Bill number 12. Do I have a second? I do. Any discussion on the do pass motion? Hearing none. Adam, would you call the roll on the do pass motion for
To
the
do
Senate Committee
pass
Substitute?
Senate Committee Substitute, House Committee Substitute for House Bill 12. Senators Huff, Black, Bean, Brown, Searpoy, Crawford, Fitzwater, Henderson, Hudson, May, Nuremberg, Washington, Williams. 13.
By a vote of 13-9-0, no, you voted do pass Senate Committee Substitute for House Committee Substitute for House Bill number 12. And now make a motion we take it for consideration before the committee House Committee Substitute for House Bill number 13. Do I have a second? I do have a second. I now make a motion that we adopt the Senate Committee Substitute for House Committee Substitute for House Bill number 13. Do I have a second? I do. All those in favor of adopting the Senate Committee Substitute, please say aye. Those to the contrary say no. The ayes appear to have it. The ayes do have it. You have adopted the Senate Committee Substitute. I now make a motion we do pass Senate Committee Substitute for House Committee Substitute for House Bill number 13. Do I have a second? I do have a second. Any discussion on the Senate Substitute? Hearing none. Adam, would you call the roll on the do pass motion, please?
To do pass Senate Committee Substitute, House Committee Substitute for House Bill 13. Senators Huff, Black, Bean, Brown, Searpoy, Crawford, Fitzwater, Henderson, Hudson, May, Nuremberg, Washington, Williams. 13.
By your vote of 13-9-0, no, you voted do pass Senate Committee Substitute for House Committee Substitute for House Bill number 13. I now make a motion we take up for consideration before the committee House Committee Substitute for House Bill number 17. Do I have a second? I do. I now make a motion we adopt the Senate Committee Substitute for House Committee Substitute for House Bill number 17. Do I have a second? I do. All those in favor of adopting the Senate Committee Substitute, please say aye. Those to the contrary say no. The ayes appear to have it. The ayes do have it. You have adopted the Senate Committee Substitute. I now make a motion that we vote do pass the Senate Committee Substitute for the House Committee Substitute House Bill number 17. Do I have a second? I do have a second. Any discussion on the Senate Committee Substitute on House Bill 17? Hearing none. Adam, would you call the roll on the do pass motion, please?
To do pass Senate Committee Substitute, House Committee Substitute for House Bill 17. Senators Huff, Black, Bean, Brown, Searpoy, Crawford, Fitzwater, Henderson, Hudson, May, Nuremberg, Washington, Williams. 13.
By your vote of 13-9-0, no, you voted do pass Senate Committee Substitute for House Committee Substitute for House Bill number 17. All right, I now make a motion we go out of executive session. Do I have a second?
Second.
I've got a second. We are out of executive session. Before I adjourn this committee, I just want to say thank you again. I mean, I've said it a couple of times, but this takes a tremendous amount of work, and I know the committee's put a lot of time in, but our folks downstairs have put a lot of time in, and our staff has put a lot of time in, and I just don't ever want to overlook the hours that go into this. I mean, we spend a little bit of time in this committee room, but there's a whole lot of stuff that goes on behind the scenes also, and I know you all appreciate that. But pretty much every opportunity I have, I'm going to say thank you to our folks that are over there up against the wall and behind me and in front of us, because you guys do a pretty phenomenal job. So with that, we will adjourn this committee today. Thanks for hanging out, guys.